Hello, everyone. Thank you so much for joining our 7th workshop to build a national movement to prevent trauma and foster resilience. As we build the momentum for this movement, we've gotten to a point now where we feel that we really want to engage with our audience about how to. We've heard a lot about all the different activities that people are doing to in their own sectors to make a trauma-informed system, sector, structures within our communities. Now we're going to talk about how to do that. And so we're really excited about what we are going to be presenting today. My name is Dr. Diana Fishbein. Everybody calls me Denny. I'm a senior scientist at the Frank Porter Graham Child Development Institute at the University of North Carolina. I'm part-time faculty at Penn State University, and I'm the founder and co-director of the National Prevention Science Coalition to Improve Lives, which is one of the sponsors of one of the hosts of these workshops. And so here you see the 3 organizers of these workshops: the Campaign for Trauma-Informed Policy and Practice, PACE's Connection, and the National Prevention Science Coalition to Improve Lives that I just mentioned. In addition, we have over a dozen organizations that are co-sponsoring this workshop, and they all have this collective vision to really inspire this movement. As you can see here, there are quite a few. And I want to present the agenda for the workshop today, which is building the movement by it's supposed to be activating and equipping local coalitions. And you can see here that we have a very full agenda of people that are actually doing this work. We're featuring presentations on approaches that these individuals have found to be very effective in persuading leadership within their sectors and their communities to embed trauma-informed practices. So we have representation here across the spectrum, from education, child welfare, healthcare, and the justice system, that map to our previous workshops. We also are going to be featuring some community engagement methods to create resilient communities and opportunities to influence policy. And while the sessions to date have focused on trauma-informed and resilience-focused and healing work across sectors, this session is really highlighting strategies that you can use to influence key leaders and stakeholders to create the conditions that are needed for this change to occur, and identify also sources of funding for community coalitions. Our next workshops are going to feature addressing trauma that extends from climate change. And we're also going to be talking about environmental justice. That will be on April 15th from about 1 to 3 or 4 p.m. Eastern time. And then on the last workshop, we will be talking about policy and advocacy, and featuring both legislators and policymakers and advocates, but also how to advocate. And that will occur on April 29th. So if you will allow me, as you usually do, to deal with some housekeeping tips. Of course, you all already know to exchange with one another in the chat to get a sense of who's there and a sense of community about you. So we will identify those important talking points in the chat afterwards and add them to our resource base. So feel free to add your links and other resources that you want to share. I wanted to mention that we are now giving certificates of attendance to those folks that attend and complete these workshops. So please contact us. Also, if you have questions for the speakers, please don't submit them to the chat because we just can't track them. They go by so quickly. Please submit your questions to the Q&A, and we will try to track them and respond to them. And speakers, after their talks, will respond to them in writing. Store the invitation link you have for this workshop. Let me start that one again. Store the invitation link that you already have in a safe place, because it's the same for every workshop. Also expect an email from us asking you to complete a very brief survey afterwards so we can evaluate our efforts. And afterwards, after the session, as always, we have a breakout session that has been very lively and very informative. So the link will be provided towards the end. Jesse will provide the link, and it can also be found on our website to join the breakout session. And finally, we are still working. There's so many resources, so we don't quite have our resource website ready yet, but it will be very soon. And our resources will include recordings, handouts, PowerPoints, websites, and other materials that will appear very soon. But the actual videos of the entire workshop are basically available about 5 days after the workshop. So this workshop will be available next week. So I'm going to stop my share, and I'm going to hand it over to Jesse Kohler, who's the Executive Director of CTIP.
Thank you, Denny. And Denny sells herself short with her wonderful DJing skills, as we have seen throughout this workshop series so far. Just a quick word that this workshop is, the whole series we developed really with the intent and purpose to be a how to mobilize trauma-informed policy and practice in your communities, in your states, and across the country, and hopefully around the world as well. And so this is really important as we bring together all the sectors we've talked about and hear from leaders in how to go to leadership in each of these sectors as we advocate, as well as go through, broad community efforts. And in that, sort of statement, just want to highlight that the trauma-informed, resilience-focused, prevention-focused, and healing-centered movement really is for everyone, and there is a place for everyone to be a part of this movement. With that, we recognize that people on this call may come from different paradigms, different ideologies themselves. And we just want to remind folks to be kind to each other in the chat. This is an opportunity for all of us to learn, for all of us to be together in this space and grow this movement together. And so I just wanted to throw that out there. We are so happy that each of you are with us today. Denny and I monitor the chat. And so we just want for folks to be kind and compassionate to each other as we're all here to learn together. So thank you for being here. We're so excited for this session and the last two that are upcoming throughout the rest of this month. But without further ado, I want to turn it over to Matthew Portell, who is a former principal at Fall Hamilton School in Tennessee and is now the Director of Community for Pace's Connection, and a fellow disruptor with a lot of other titles that he can go on about. So Matt, I turn it over to you. Matt, you are muted.
This is my first time using Zoom. That is a joke. That is not serious. But nonetheless, thank you all for being here. And Jesse, thanks for having me here. Just 3 weeks ago, I was serving as a principal at Fall Hamilton Elementary School in Nashville, Tennessee. But given the opportunity, I'm now the Director of Communities with Pace's Connection. Because again, this work is a movement, and it's about us moving the work forward. So this could be one of the most complicated things I've ever done, and that's talk about how do we advocate for this work in only 15 minutes, but I'm going to do my best. So I want to start off by saying what between people that I've worked with, schools that I've helped transition into understanding the complexities of trauma-informed education, and those advocates around the country, it really comes down to this. It comes down to its brain science, right? And more. And so I think what I've always encouraged any educator, whether they're a paraprofessional and an aide at a school, or it's a teacher, or it is the principal, or it is somebody in the central office, it doesn't matter. It all comes down to starting here. I think paradigm shifts happen when we actually can base it in fact and present that to those in positions to allow these paradigms to shift. So I would say to anyone, you have to start with this PACES science, right? Understand the basis of where this movement started, but also know where this movement is going. We have to have people understand that it's beyond the ACE study. That was an avenue and a conduit for a lot of people, including myself, to understand the impacts of adversity. But we're moving past that. So we also have to talk about the impact of brain and toxic stress. I think right now more than ever, we have more opportunity and education to start having this conversation. I think it's one of the opportunities that has been developed out of the pandemic, where now mental health and stress and trauma are now being talked about in ways that they've never been talked about in the field of education. We also have to move past it's just about the brain and understand the influence of the body, the physiological response, not just the neurological response. So understanding the autonomic nervous system and how those parasympathetic and sympathetic stages in our nervous systems, how that plays out in a school. If I've heard it once, I've heard it 1,000 times. All I asked them to do or her to do was to get a pencil out. Next thing I know, they're throwing a desk. Right. So again, basing it in this the PACES science, but also understanding how ACEs are passed down from generation to generation, and not just, but looking at the historical aspects of that, the historical trauma and intergenerational trauma that has happened in communities, in certain sectors, certain areas, within racism, within the experience of our historical context, and that is including the indigenous, looking at the impact of LGBTQ plus students. So talking about how this plays out over time, not just in the moment. And then lastly, understanding that the power of resilience, how the brain and body can heal, right? It's not just about what has happened to somebody, it's also about what can happen. And I think the P in PACES is the really exciting part of the work that PACES Connection. And one of the reasons that I felt so motivated to join is it's not just the adversity, it's also looking at the positive interactions. And so thinking about healthy systems, healthy communities in schools and the roles they play in that. But to me, if you're going to approach anyone in this work, you have to base it in the science. And again, it's not just brain science. It goes all the way back to looking at historical context, to understanding the complexities of our systems. The second thing I want to tell you that I have found to be successful in those that I've worked with and the colleagues that I work next to in this field is data tells the story. And I want to share some data with you that I think is important. That I will be happy to share in writing after this as well, is that children who experience trauma, and I think I'm going to step back for just a second and say, I think it's also important to have an aligned understanding of what trauma is. I've also learned that trauma can be perceived differently by different people, especially by life experience. So I think having a general understanding that trauma can serve as an umbrella used to describe the inability of an individual or community to respond in a healthy way, physically, emotionally, and mentally to acute or chronic stress. That was actually given by the Washington State Office of Superintendents. I love that one because it isn't necessarily what happened, it's how the person responded to what happened. So I think it starts there. So when we get to data, I want to share a few that I think when we're advocating in schools, it's really important to know that children who experience trauma and do not have a support system are 2.5 times more likely to fail a grade in school, right? Without supports. They're more likely to score lower on standardized assessments. They're more likely to have struggles in receptive and expressive language. They are suspended and expelled more often, and they're more frequently placed in special education. And those data pieces came from the National Traumatic Stress Network. But it goes beyond that because I think we have to understand the impact of the data. And I'm going to give you a little bit more. That the ACLU and UCLA's Civil Rights Project brought some things to light that I think educators need to be aware of. That and this data is a little bit older, but in 2015 and 16, the Office of Civil Rights noticed that over 96,000 schools were in a study and 11 million days were lost. I'm going to say that again. 11 million days were lost due to exclusionary discipline practices. I usually show a graphic, and it is a gentleman dangling a kid out of the window and saying, we don't have time to save this one. We have to understand that this is tangible data. And so another one is that there is an equitable access to instruction because there's disparities in discipline practices, and that primarily finds through the overrepresentation of Black youth and students with disabilities. So now we're talking about civil rights pieces, right? And so we also are talking about that there's 10 million students who attend schools with an SRO with no social worker. We have to think about those pieces, right? If we have students who we know, especially now that this conversation has happened, kids have struggled forever. I struggled in school. But now that these conversations have happened, we now know that it's an opportunity to share some of these data points, right? The Council for School Counselors says that the ideal is 250 kids or one counselor per 250 kids for a school counselor. And actually nationally, we're closer to 444 kids to one counselor. That means that 36 million students are enrolled in schools that don't meet a ratio. So I want to say this, right? I want to say, somebody asked what an SRO is, student resource officer. And by no means am I saying that's not it, but we have to look at the priorities, right? If we know we have kids who are coming in with trauma, stress, and impacted by life experiences, we have to be able to think about healing, right? And I think we all believe with that. But if you see at the top of the slide, I put intent versus outcome. And I think it's time that we start having conversations in education about the intent versus the outcome of the production, right? The intent is, I've never met an educator that got into education to hurt children. I've never met it. I've never met one. Unfortunately, sometimes the policies, practices, and actions of schools end up hurting kids. And I said it right. Schools can traumatize children. And so I think that is another avenue of a conversation of the intent. What is the intent of your classroom? What is the intent of your interaction at school? What is your intent as a principal? What is your intent as a school board member? What is your intent as a lawmaker? And now let's look at the data and say, is that outcome matching the intent? And I can tell you that in most cases, that will not be the case. That kids are absolutely being impacted by the policies, practices of schools. And so it goes beyond that too. And there's so much data out there to this. When I put actionable pedagogy, I mean moving from compliance to connection, both relationally and pedagogically. Now, just last night, I spoke to Zaretta Hammond, who is the author of Culturally Responsive Teaching in the Brain. And she left me with so many thoughts, where she even made the statement that we have a pedagogy of compliance in our schools. That means we have pedagogy that drives kids to sit, be quiet, listen, right? And we have to move beyond that. We have to move beyond compliance and to connection. So when I say actionable pedagogy, I mean relationship-focused, community-based, right? And what I mean by that is, for example, there is a widely used method in education that feels that reinforcing students with a ticket or an object or something that builds intrinsic motivation. Dr. Bruce Perry's most recent work has shown that transactional interactions, which means I'm giving you something and telling you what you did well, versus relational interactions, my authentic connection to you as a fellow human, have two different outcomes. And even in my own school, we had a study done by Vanderbilt University where they studied the same thing. And it was found that those relational interactions, when authentic and support, have the greatest outcome for student success. And so I think it starts with the so what, the research, and it has to move into the now what. I see a lot in the chat about the school to prison pipeline. It is absolutely provable. It is absolutely data backed. And I once said, we have to change the broken system that is the school to prison pipeline. And I want to reiterate, the system isn't broken, right? The system is designed exactly, it's operating exactly how it is by design. Education by design wasn't for every kid. And so we have to realize the historical context to the structures and systems that our schools are developed on. And so again, I can't believe that was 15 minutes-ish. But if you have questions, please put them in the Q&A. I would love to answer them. If you want to contact me for any reason, please write my email address down. It is mportel@Paces Connection. And I am on social media as Principalist and myself as Matthew Portell.
Matthew, thank you so much. 15 minutes sure does go by fast. If you don't mind, for folks in the audience, also putting the links to your podcasts and website. Matt's got a lot of incredible information that he tried to put into 15 minutes. And so there's a lot more out there for those that are interested in exploring. Please continue to put questions in the Q&A as we can get to those afterward. But from the education system over to the justice system, we are very, very fortunate to have Judge Sheila Calloway with us right now to speak about influencing the justice system. So Judge Calloway, please.
Absolutely. Thank you. Can you hear everybody hear me and see my screen all right?
Sound great.
Awesome. I have absolutely no idea how to do anything in 15 minutes. So I'm going to try and go as fast as I can. I just want to thank this opportunity to come and speak with everybody about my experiences on trying to literally restructure the court programs that we have in order to eliminate disparities. And I think it's so telling. And I absolutely love former Principal Matthew Portell. And we've done a lot of talks together, but him ending his session talking about how the system, the justice system, or what I like to call it, the criminal system, operates as it was designed, and the prison to pipeline is real. And so I've been a juvenile court judge since 2014. And it was my mission when I started was I was going to change all that. And I was going to get rid of any disparities in our system. I was going to make sure that everybody was treated on the even scale. I was going to get rid of the the school to prison pipeline, and I was going to get it done. And I want to start off just saying that, in all honesty, I have to be transparent with you all. That didn't happen. In the 8 years that I have been the judge, that didn't happen. And I think about, our roles, the schools and the justice system in the community. And number one, we have to be honest and transparent with one another. And in order to get to a point where we can start making these differences, then perhaps we will achieve things. And so I always want to say that, I would love to come and say, hey, y'all, I did it. I eliminated all disparities in the juvenile system in Davidson County, Nashville, Tennessee. I would then have to say, haha, April Fools. It's an April Fool's joke. We are not quite there yet, but beyond what we continue each and every day to walk through our frustrations, our limitations, and we just keep working to make a difference. And so as we learn to be transparent, we also have to come with the understandings that, there's a lot of us that are in this, like Matt said, and nobody in the justice system or nobody in the criminal system or nobody in the school system is out to do it, to treat children badly or to have children hurt. But we have to recognize that we have certain limitations. We have limitations on money, and everybody says, how do you do all these changes when you can't get funding to take care of them. We learned that you just have to keep up the work even without doing it. And so the thing that we started off is making sure that we knew where we were and where we wanted to be. And we want to be that court that prevents problems, that promotes the positive potential of everyone that works in the building and that pursues fairness and hope. But in order to get there, similar to what that Matt said, is you got to know where you are and then where you want to be. You got to have your data, which is key. You've got to make sure that you understand everything that operates. For us, it was like learning who our partners were in the community, learning who we could call on to say, we've got to make a difference in this area. And then making sure that we understand each and us, that we understand trauma. We understand what that is. We understand child development, and not just understanding the brain science as Matt was talking about, but moving on. What do we do next? How do we move beyond this? And absolutely believing in the science, because there's a lot of people in these systems, in the criminal systems, in the justice systems, that don't believe. And no matter how much I tell them, it doesn't help you to stand on the bench and yell at a kid. That's not going to change their behaviors. They don't understand that, nor do they believe that. But we just keep on making sure that we keep trying. So for me, the first steps of making sure that I have a trauma-informed court system through our programs is I had to make sure that my staff was understanding. And so we did this in a sense of a brick by brick kind of laying our foundation and laying the building where we needed to go for our system. And so we had to make sure that we were aligning all of our staff members with their strengths and their goals and their passions. And we literally did a lot of making sure that we were doing transparent hiring and promotions and maximizing all the opportunities and creating opportunities and making sure our grant people were treated the same way our civil service people were, and doing a lot of internal work to make sure that everybody was feeling like they were being treated fairly. Because if my staff isn't doing it, then they're not going to care to do it for the people that they serve. So we did that through other ways of supporting our employees with their personal situations, making sure that we have positive, encouraging attitude towards accommodations, offering the employee assistance program without anybody having to take leave or that it's not their part of their job, but that they can just have that opportunity. We did a lot of team building activities, fun group activities. We do a monthly newsletter that recognizes our staff and gives them the updates on things that are going on. We do court-wide celebrations to make sure people are involved. But the biggest thing that we had to make sure that we were educating our staff about a lot of training about, ACEs, about trauma, motivational interviewing, poverty simulations, all of those things that I need to make sure that they are operating and doing the things that they need to do for our clients that we serve, that they absolutely understood and that they were getting the proper training to do it right. And we definitely had to do a different take on who we were hiring. We want to make sure that we were bringing in those people that understood the folks that we're serving, that understood the traumatic natures of the jobs that we're working at, and understand also the need for that self-care. People who can be compassionate and empathetic, but having absolutely good boundaries and understanding the backgrounds of our children and our families that we serve. So in order to absolutely have a trauma-informed court that could help to eliminate some of the disparities that we see, we partnered with a local organization called the Family Center. And the Family Center is a nonprofit, so it wasn't anything that we had to pay to do, but they had a grant to work with different organizations on making it more trauma-informed. And so our vision through that project was to have a trauma-informed court system that identifies individuals who have experienced trauma, ensures the provision of appropriate intervention services, and improves the health and well-being of our youth, our families, our staff, and the national community at whole. And they did a lot of work. We formed a fostering resilience committee back in 2018 that met very frequently. It was a diverse group of people from within the court and some partners from outside of the court. Their vision statement is that we are going to have a trauma-free Davidson County, that we will create a more positive results-oriented community by empowering our juvenile justice staff to provide trauma-informed support services. They learned all about compassion fatigue and burnout and vicarious trauma, secondary trauma, and did a wellness assessment for our staff. The next steps that we had for our resilience committee was also to develop an action plan of areas that we needed to develop to organize assessments for the entire team, that we could work on making sure that we had the full staff support in carrying out all our action plans and communicate what they're doing on a regular basis and always be open for feedback. And, one of the things we're learning, we had some difficult conversations in the last couple of weeks, but we've got to, be able to hold space for honest, sometimes very difficult conversations. So there were definitely challenges that we had in coming to restructure our court and our court programs. It took a long time, and we're still working on building trust with our staff members. Things happen and staff sometimes don't understand. And in order for us to truly change the programs that we're working on, we have to be able to build that staff trust. Sometimes I have a big picture in my mind of things that I want to accomplish and things that I want to do, but I have trouble communicating that with the entire staff. And so that's one of the challenges that we've had over the time. We also have a challenge with the community and the community's misunderstanding of what it really means to be a trauma-informed court. We have a particular news media source that whenever a child is arrested or charged with something very serious, they are constantly sending out a message of, well, they'll just go down to juvenile court and Judge Calloway will give them cookies and milk, without understanding truly what it means to be trauma-informed. And trauma-informed doesn't mean that I give people cookies and milk every day, although that might be a part of it. However, it is that we are able to hold people responsible for the consequences of their actions, but we do it in a way that's healthy for that child, for that family, so that they can learn from that mistake and that they can move on and to be successful in our community. The way that we learn how to do it, basis the way that some of the public's misunderstanding is about it, is we do it in a way that we are encouraging people to change and to we're helping them to build their resilience as we're building our staff's resilience. Another of the barriers that we had were involving staff in decision-making while still getting things done in a timely manner, and making sure that our work environment and our space issues are trauma-informed when we're in a very non-trauma-informed type building. A courtroom and a court setting is not the best type of trauma-informed place to be. But those are the things that we worked on in order to restructure our court programs, and not to, my ultimate goal definitely is to eliminate some of the disparities, but just to make sure that we are providing the best trauma-informed services for the children and the families that we serve. So yes, we've had a lot of bumps on the road. We've had a lot of community issues and partners that haven't always been on board. However, we've had a lot of success. And what we know is that slow and steady wins that race. And that is the things that we are doing. We are taking our time to make sure that we are providing the best trauma-informed services for our community. In doing that, we have seen a drastic decrease in juvenile crime throughout our county. So by the end of, end of 2013 to the end of 2020, juvenile crime in Davidson County had decreased by 63%. And in 2021, those numbers are still about the same. So literally, in between the year of January 2013 until that time of June 2013, we were arresting about 2,500 youth in our community. That same time period in 2020, that number was down to about 932. So literally a 63% decrease in the number of youth that were being arrested. And even beyond that, we are diverting a large number of youth from the system completely. So we want to eliminate our disparities by not putting children in our system. And so when there's a possible case or a complaint against a youth, we will divert them from our system and not prosecute them, but work with our community partners to provide care for these youth within the community. And so for all of the cases that we diverted in the years of 2017 and 2018, we are averaging about only between 6 to 8% of those youth coming back into the system at a later date, 2 years later. And so we are finding that it is absolutely imperative that we do not put people in our system, and so that they can literally be successful in our community. We know that these are our children. I love this quote by James Baldwin. They are our children, and we will profit by or pay for whatever they become. And so in order to have them to become a successful children within our community, we have to make sure that we are providing the best trauma-informed services from every end of our courthouse, from one end to the next. And I think I made it in my 25 minutes. I mean, my 15, I only have 15, right?
Judge Calloway, regardless of the number, you were right on time. So thank you so much. We've got a lot of love for you in the chat for all the incredible work and information you shared. So thank you, as well as a few questions in the Q&A. If you can take a peek there and help to answer. If folks have questions coming in after that presentation, feel free to ask them for the judge in the Q&A, and we can get to those there.
Thank you.
Thank you. Unfortunately, our next speaker, we were going to go to healthcare. Don't see David on just yet, trying to get in touch with him. So in not necessarily the most TI fashion, wondering if Treva, if you are there and can turn on your camera, we are prepared and ready. Thank you. So we're just going to switch the healthcare and child welfare parts right here. But Treva Johnson is the director for National Public Policy for the Family Focused Treatment Association, a wonderful leader in the foster care and child welfare space. So Treva, I turn it over to you. Thank you for being with us.
Thank you so much, Jesse. I am excited to be here this afternoon. Hello from sunny yet windy North Carolina. And again, just great to be here and following in the footsteps of some great leaders. I'm going to focus more on the entire child welfare system. I'm also going to turn off my camera in hopes that I will not lose everybody with the low bandwidth I have today. Okay, so as Jesse mentioned, I am the National Public Policy Director with the Family Focused Treatment Association. The Family Focused Treatment Association was founded in 1988 with the idea of developing, promoting, and supporting what at the time was known as therapeutic foster care, later known as treatment foster care, and now known as treatment family care. I've been with FFTA for 3 years. We currently have about 500 member agencies in every state in the United States and throughout Canada. And those 500 member agencies serve more than 500,000 children and their families every year. So again, really excited to share with you what we do. It's always important for me to note for folks that 25 years before I came to FFTA, again, I've been here 3 years. For 25 years prior to that, I was the executive director of an agency, a private agency that provided treatment foster care, treatment family care, traditional foster care, adoption services, relative and kinship care, and wraparound services for both children and adults. So I feel like I kind of know both sides of the system and that we're working in. I've spent 25 years working in the system, and I've spent the past 3 really working hard to change the system. So with that being said, I'm going to attempt to move to my next screen. Okay, so basically although my focus today is really going to be around child welfare in general, The ideas that I'm going to be highlighting and the resources I'm sharing, the things we're going to be talking about are really adaptable, they're universal, and they can be used in any advocacy campaign. So grassroots, that is what we're known for within FFTA and within several of the other associations and agencies that we work with. So grassroots, of course, is finding the strength in numbers. It's all about those numbers, using that strength to impact real and lasting change. It is the most powerful form of advocacy. All legislators, federal, state, and local politicians, and their continued success depends on their ability to engage with and satisfy their constituency. It is again, the most powerful thing is a committed group of citizens that can change the world, that believe that they can change the world. So some tips that I wanted to share today, it's a few ideas that we found to be successful in the campaigns that we have not only hosted, but supported across the country. They've really been effective in a number of ways. So number one, and you've already heard this from the two previous speakers, know what you're talking about, right? Educate yourself. The most essential part of being an effective advocate is knowing what you're talking about. Know your issues, do your homework. You have to take the responsibility to know those issues, to know the data, and most importantly, to understand the entire issue, not just how it affects you or your agency, but the entire perspective for the issue. We say to folks, share often and share everywhere. Our voices are the most important and powerful tool that we have when we're talking about advocacy. The more voices that we hear in unison, the more powerful and greater that change becomes, the more meaningful and lasting we see that change. And finally, on this slide, follow up and then follow up again. Reach out periodically to ensure that you maintain that relationship, right? Once you have that relationship, you maintain it. And something that Judge Calloway said that I just want to piggyback on is sharing events successes, right? So you want to be sure that you're not just calling when you want something, right? When you want a meeting to talk about an issue that needs to be changed. Hey, I'm calling today to say we have decreased this number by 63% this quarter, and I want to share that success with you, right? So it's sharing those events that are also meaningful so that you have a true relationship with those folks that you're going to be working with to change the system and to truly change the world. One of my favorite quotes from Einstein is, if you can't explain it simply, then you just don't understand it well enough. So you've got to be able to understand, to explain. So really important to keep up with that. Moving on in the same frame is developing and distributing and sticking to clear, concise talking points. So you've got to have a clear message, you've got to have objectives, and you've got to be sure you discuss this with the other advocates in your campaign. One of the things that FFTA does, and I'm going to talk just a bit more about that in a moment, we host an annual advocacy event every year. It's actually our 20th year hosting, but it's only our 19th event because we did cancel the first year of the pandemic. But one of the things that we do before this event that is normally held on Capitol Hill, but it has been virtual the last 2 years, is coming up with talking points. We call those our key messages. And it's really, that's a lot of work in and of itself, because again, as I mentioned, we have 500 member agencies that provide a vast array of services, and everything is important when you're a part of that agency. So we usually come up with 3 to 5 key messages. These are the points that we're going to be talking to our members of Congress about when we do either our in-person or virtual visits with the Hill staff and with our congressional members. In addition to the key messages or those talking points, we also develop a digital leave behind. Used to be paper, but we're saving trees, and so it's a digital leave behind. So we have our clear, concise talking points or key messages for our advocacy groups, and we have our leave behinds for the members of Congress that they meet with. And what we do before, usually about 3 weeks before our event, we actually have a webinar, and we just go over those key messages. We go over the leave behind. We go over just basic rules of the road when you're having these meetings and how long they should take, and making sure everybody's sticking to the points. We also record this webinar, so even if someone can't be part of the webinar, but they still want to be part of one of the advocacy teams going to Capitol Hill, then they can go back and look at the webinar at any point in time to be sure they've got all of those talking points down. Again, stories are powerful, and you all know this, but consider having those real life stories when you're going to take your message across. Short videos, Instagram stories, just anything that really can hammer that point home. We at FFTA partner with the National Foster Care Month campaign, and this year it's an annual, it's in May every year, and this year the theme for National Foster Care Month is supporting relative and kinship caregivers, right? And if you've gone to that website, you're going to see that there's a lot of initiatives and resources and information on there, but there's also video stories. And those video stories of grandparents raising their grandchildren and cousins and siblings raising siblings and neighbors down the street that took in these children as part of their family to raise, those are the most powerful things on that website, and they really make a difference when we're going to go to our legislators this year to talk about kinship and relative caregivers and the support that they need. So again, stories are super powerful. Some of the other things we found to be effective. Of course, I mentioned we do host a week of advocacy. Some other things we've seen members do across the across the country that we also support. We've seen movie screenings. Of course, I've got virtual in front of everything here because we have been in a virtual world for so long, but hopefully you're able to do some things in person again. But a virtual movie screening night, a virtual book or poem reading, an art show. Again, what you choose to do is limited only by what you choose to do. So really we encourage folks to think outside of the box. And this goes without saying, but relationships are vital. True sustainable advocacy is built on the strength of those relationships. And I just cannot stress that enough. The consistency of the message, a compelling story, and that real data that Matthew mentioned to back it up. Right? You have to have those things to be successful in your advocacy campaigns. Reach out and initiate those relationships. And then again, as I said before, take care to maintain them. Follow up and don't just call when you need something. Call to share something positive or wonderful that's going on in your agency or your community. Common bonds, we all have them. Sometimes it takes a little homework to realize what they are. And I'm going to give you a personal example here with myself. In my home state, we recently elected a new lieutenant governor. I knew very little about this person. He was not someone that was not on the political scene, really a newcomer. And I went to do my homework before I wanted to reach out to talk to our new lieutenant governor about the child welfare field in my home state. And it didn't take long to find out that our new lieutenant governor grew up in the foster care system and graduated high school while in a kinship placement. How wonderful was that conversation opener when I went to our lieutenant governor to talk about the foster care system in his home state that he grew up in. So again, know who you're talking to, find that common bond, and that really helps forge those relationships. And this has already been mentioned several times, but public-private partnerships are crucial to success. One of the things we do in FFTA, and we are always thankful to the CTIP campaign folks, Jesse and Dan and Marlo, who jump on and help us. We have a focus group that consists of members, and that's member agencies, community members, anyone that wants to be part of these focus groups. One of our focus groups is a trauma-informed care focus group. And when I was talking to our focus group folks about this particular webinar today, I asked if anybody had any suggestions, anything they'd really like for me to share. And without even knowing that I was going to be talking about public-private partnerships, one of our member agencies in Indiana said, public-private partnerships make all the difference here in my home state. She went on to talk about a bi-weekly meeting that her private agency holds with the Division of Child Services to talk about issues that they're having, successes that they're having, concerns. They also have a bi-monthly meeting to discuss opportunities and successes from the lens of a provider, and then flipping it over and discussing those same content areas from the lens of the state. And lastly, every year they do partner together and put on a trauma-informed symposium. And so again, that public-private partnership really works. And it also works when that public-private partnership comes to Washington to share those successes, to share that teamwork, working together to make a difference in the lives of those children and families. So great example from the state of Indiana. Now, I've mentioned this, but every year, as I said, we have a Public Policy Institute. For 2022, we actually have, the registration is open right now. It's a free event. It's open to anyone. This year, it's May 17th and 18th. We're virtual again this year. And one of the things that we started doing last year, brand new, that I just wanted to touch on because I'm sure I'm almost out of time, is our Dr. Laura Boyd Advocate of the Year Award. And Dr. Boyd was my predecessor in this role. She was with FFTA for a number of years, and she was responsible for organizing the Public Policy Institute when it was held on Capitol Hill every year. And we felt like it was just necessary to recognize all of the hard work that she did and how far she took us in the advocacy field for child welfare. And so the Advocate of the Year Award, again, we weren't exactly certain how this was going to go. First time last year, it was virtual. We're still learning everything. So we basically put out applications for nominations with some ideas of what we were looking for. We were amazed with the number of applications from across the country that we received. We had a group of folks that were willing to be part of a committee that came up with the top 3 nominations that they felt met all the criteria. And then here was the amazing thing, folks. There were over 80,000 individual votes for these 3 nominees. 80,000 people were so excited about the advocacy work that these folks were doing across the country that they really got competitive. And for a week, there was a lot of voting that went on. At the end of that week, we recognized Julia Kessler as our first ever Advocate of the Year recipient. And needless to say, with the success that we saw, we actually have nominations open again right now this week through the end of next week for the 2022 Advocate of the Year. And Julia is in West Virginia. She is the Director of Social Services for the Children's Home Society of West Virginia. She was recognized for a number of pieces of work, more specifically for ensuring the passage of West Virginia House Bill 4092. And basically, 4092 really changed the landscape for child welfare in West Virginia for some 7,000 children and families that were in the foster care system. And one of the things that Julia said when she was accepting her award that was just so telling was, it is everyone's responsibility. Advocacy is not my responsibility as the director. So I'm accepting this award, but I'm accepting it on behalf of everyone that worked so hard to pass this legislation. And she went on to say that not only do they believe that this is everyone's responsibility, they've actually got it written in every job description that advocacy is everybody's responsibility, right? So everyone has to be aware of what's going on within their community and within their state all the time. And she also gave some great examples of some of the things that her agency was doing there in West Virginia. Something akin to a lunch and learn where they invited local and state legislators, county commissioners, just members of the community, school board members, just to come and hear or see what they do every day, not asking for anything, letting you see what we do every day so that when we do come to you and say, this is what we're advocating for, you're going to understand absolutely 100% why we're advocating for this, because you've seen what we do every day. So some super, super smart things that we saw coming from West Virginia, and I'm excited to see what we're going to hear from our Advocate of the Year for 2022. A couple of closing thoughts. Again, I've already mentioned, Julia said advocacy is everyone's responsibility, and that is so very true. One of the, when I was talking to our focus group on trauma-informed care, Kelly Gnu there in West Virginia as well, she shared that legislators want to feel human, not like a bridge between a problem and a solution. Talk to them as such, and they'll want to talk to you about your problem and their role in the solution. And finally, Dr. Laura Boyd, who said there is no policy without advocacy. Advocacy never sunsets. I am sure I'm out of time. I will definitely share my slides so that you all will have those links and that information. Thank you so very much for letting me be here with you today.
Treva, that was spectacular. So such important lessons and encouragement for everybody to be part of the process, and that integrally involves advocacy. So that was very, very informative. Thank you so much. I'm going to jump now to Dr. David Willis, who's a senior fellow at the Center for the Study of Social Policy, and he will be talking about transforming healthcare systems from the inside out. David, are you able to show yourself?
Can you hear me? Can you hear me?
Yes.
All right, can I share my slides?
Yes.
Here we go.
Try that.
How's that?
I get, yes, okay, there we go. Thank you.
So we're good.
Yes.
So thank you for the opportunity, Denny, to be with you all today. And I'm really eager to bring you some thoughts about the healthcare system and the transformations that are moving in the healthcare system, and as we say, from inside out. And I'm a pediatrician, developmental behavioral pediatrician. I'm currently a senior fellow at the Center for the Study of Social Policy. And I am focusing on this earliest period that we talk about as early relational health. You all know the science of prevention really looks way upstream as to the power that goes on in those relational, dyadic, bonded, attachment, emotional connections, interactive, safe, stable, and nurturing relationships so very early. And the science is compelling that those fundamental foundational relationships drive the development of health, developmental capacities, educational capacities, social emotional well-being, preventive mental health, engagement in communities, workforce and work capacities, and so many of fundamental relational capacities and skills are built by those very fundamental experiences. You all know the science that talks about the core story of child development that Jack Shonkoff and the team of the at Harvard Center have been talking about, and our group has been focused deeply on, and what is that environment of relationships? What are the elements and the critical components of those early relationships that build health, development, and well-being, and increasingly are recognized to counter toxic stress, adverse childhood experiences, and the like. And I'm trusting that you all also recognize that we're moving far beyond just thinking about adversity and adverse childhood experiences as limiting, but rather thinking deeply about the protective forces of positive childhood experiences simultaneously. In fact, the mitigating force of powerful connected relationships to mitigate against adverse childhood experiences is compelling. And the whole movement is in healthcare understanding, in building health and development, is recognizing adversity, but assuring that there are safe, stable, and nurturing, buffering, and protective relationships to counter those forces. One would say that relational health is both protective against adversity, but also promotive to the development of well-being. And that's what's ever most exciting in our field of child health care. I've been involved for 15 years in building beyond the knowledge of adversity and moving to the resiliency forces, the promotion, prevention forces, and harnessing the power of relational experiences. We went through the journey at the American Academy of Pediatric, a task force on early brain and child development. That work grew within the Academy to being ever more promoting in terms of safe, stable, and nurturing relationships. And then just this year in August, Andy Garner and team put out this new, I would say, seminal policy paper that calls for focusing on safe, stable, and nurturing relationships in primary care to buffer adversity and build resiliency. But here's the key statement. pediatric care is on the cusp of a paradigm shift that will reprioritize clinical activities, rewrite research agendas, and realign our collective advocacy. That's an accelerator and an opportunity, as the title says, to promote relational health. And I would argue that the focus on early relational health is now here to stay and captures maybe a new concept for some of you. A new term for some of you, but not a new concept. It builds upon the decades of research that you are, I'm sure, keenly aware of from the fields of child development, infant mental health, their development, early relational health, though, and we've been very intentional to focus on the centrality of safe, stable, and nurturing relationships, because actually they are the key drivers of building health, assuring development, and maintaining and promoting social well-being. And isn't that really essential now in face of the growing impacts of the stress of the pandemic, the growing mental health crisis, the crisis our country has as a society thinking about crisis of connection? All of that is begging for our focus on these connecting elements of early relational health. Early relational health is foundational, and it's foundational for both a caregiver and a child. It's dyadic. That two-way nature of these fundamental earliest relationships affect two-generational health. They also create those moments of well-being that have long-term impact. So when we focus on these foundational and supportive contexts around the relationships and support the relationships themselves, caregivers and their children thrive now in the moment, but also into the future. So we consider this really a movement of this paradigm shift in child health care that's really calling out a new way of operating. Just for fun, I want you all to pause for a moment and observe this relational space between a parent and their lovely little baby, and think about the relational health and what you're witnessing, and begin to think, if you could articulate, what are the elements of this relational health moment? And I'll narrate a bit. You see affect, you see facial interaction, you see eye contact, you see shared experience, you see turn taking, you see each is reacting to the other. In the dyadic sense, they are connected, they're emotionally connected, and we know so much of what those capacities do to build relational health. Essence, you were just witnessing some of the vital signs of early relational health that are observable. They're observable in the moment, and they represent what we can talk of as emotional connection, and building off the work of Martha Welsh and the Nurture Sciencing program that has been captured in her research with the Welsh emotional connection scale. But those four elements of mutual attraction, mutual vocal communication, mutual facial expression, and that reciprocity and interaction are really vital signs that define emotional connection, but they have deep physiological impacts directly to the autonomic nervous system, to the stress regulation system, to the regulation of emotional and regulatory stress states, and appear in first good research to be supportive of then social emotional well-being in up to 18 months, up to 3 years of age. This trait, let me state that, this state of emotional connection is meaningful and important and observable. So from a health system view, more and more efforts are being focused on this relational frame. And 2 years ago, at the Center for the Study of Social Policy, which is where our early relational hub sits, where our network leadership is building teams and networks of organizations moving into this relational health action, we did a survey into the early childhood field, learning that there's a lot already going on, not the least of which is our Reach and Lead networks that I'll talk about in a moment, but there are supporting efforts that are reimagining child health care around promoting first relationships in pediatrics. The keystones of development building off of the mind in the making work are being advanced into residency training and championed across residencies programs across the country in pediatrics from Mount Sinai. There's a movement in child healthcare to become team-based in the way that it's not simply one pediatrician or one family, but rather a team that builds out the support structures and partnering with families that uses additional team members focused in this developmental promotion relational health effort, identifying the needs of families, connecting to communities. And there's a growing movement increasingly currently with ARPA dollars and with new investments through federal government that are coming out through HRSA to strengthen healthy steps models, which have developmental specialists in pediatric practices, the Project Dulce model, which has a community health worker within the medical home to support families. The movement now that's happening with ARPA dollars in all communities across this country to build out community health workers, home visitors, behavioral health team, which are in effect relational health workforce expansion. We're working with teams of people to build observational tools, measurement promotion tools, and there's efforts to build out this workforce that becomes increasingly focused relationally, and the work's moving deep into place-based communities that are exploring likewise how to move all of this work forward. So we're rethinking pediatric primary care with this team-based care model, overarching this good work with a relational frame. The team-based care models that I've mentioned, that Healthy Steps and Project Dulce are really basically redesigning and imagining from the inside health system transformation. And as these models are developing, they bring in the voice of the neighborhood and the community and families to drive some attention to equity, building trusting relationships within the medical home with families, countering the racist structures in healthcare that have to be countered by listening authentically and partnering with families in ways that are meaningful to them, and attending and engaging with families in ways in support of what matters to them deeply too, which is the health and well-being of their families themselves. Our relational health work is advancing from equity first, partnering with family too, and engage deeply with the community, and expanding that medical home to connect with the community itself. This is where that relational health workforce opportunity is growing. The connection is really a social determinant of health. A mother or baby that's isolated and alone must be considered an emergency. So mobilizing communities where family-friendly neighbor communities, where informal systems of support surround new families with new babies, where there's an intentional effort to make certain that every new baby and family has the supports they need to try and counter the vulnerabilities that they face, either historically, either by racial struggles, either by poverty or housing and the like, but to be very intentional to recognize that supporting the foundational relationships of families by addressing the community needs that would otherwise disrupt a family's hope for well-being is the next stage of all this work moving forward. Hence, the building on the relational health workforce in this moment in time, linking them with the medical home, building the network of family supports that can be brought into partnering with the medical home, who's eager to be more effective, more equity-based, more collaborative, more team-based with its community is really important. Few last comments. We're currently, with our work with early relational health, have partnered deeply with the Reach and Read network. You may well know that across this country, at least 30 to 40% of pediatricians in primary care, and almost 80 to 90% of children of risk are actually in medical homes where there's a focus on providing literacy promotion by book sharing. But the fundamental of Reach and Read is in fact relational. And we began a partnership with their effort in their what's called the Next Chapter Agenda to actually intensify the way that all pediatricians within the Reach and Read network, which we hope will become a standard of pediatric care are first relationally focused, partnering with families intentionally, strengthening those emotional connections, utilizing the gift of the book as a means of talking with the relationship experience, and monitoring and promoting the relational health is the foundation for then early literacy. And to work in this sense of health systems redesign from an outside view are, of course, all the policy opportunities. To support early relational health, the policies in this space have to be strong in the prenatal to 3 space, and they have to be increasingly supporting not just the individual baby, but the families themselves, a responsive early relational health center. All of our policies have to be intentionally focused on the stresses and the supports that would disrupt the family's capacities, desires, hopes, and I would argue healing capacities that happen in the perinatal space because of not enough resources and support that would overwhelm their desires and their ability. Policies have to address poverty. They have to address the opportunities of access to health system services, to housing supports, to other resources. And the key strategies of policies have to be 2-generational. They have to be strengthening the families around young families. They have to tackle racism, poverty, and other social determinants. And we're articulating policy goals in order to reach this that go everywhere from thinking about equity, but also keenly with economic security and the pressure that has to be brought to bear to Congress about the criticalness of the child tax credit. Training is a critical element across all sectors relationally, as well as promoting services in supports of early relational health, not only in the medical home, but within home visiting, the promontories, early care and education systems, building out then our relational health workforce, expanding this high-performing medical home that we talked about as becoming a standard within Medicaid, and then also building out deeper consultation and support services when there are families that are identified that need more effort. All of that has to be done within a system effort. So finally, I just want to say there are many resources that we're bringing available from our resource at Center for the Study of Social Policy. We just released a series of short video perspectives on early relational health that capture perspectives and different points of view about the space that we're talking about. This is my contact information. Here is our website that has our materials at the CSSP. The perspectives I just mentioned are here. And if you want to follow the movement that's happening with this early relational health, sign up for our monthly early relational health newsletter. So thank you for the opportunity to be with you. I'll close down my slides. And Denny, any questions or comments that are coming up that we should attend to?
So that was spectacular. That was absolutely right on the money. What we're asking is for speakers to look at the Q&A afterwards and then respond in writing to some of the questions. We've responded to some that we were able to, didn't require your response, but those that are remaining exist in the Q&A. And thank you so much. That was just such an important framework, really, with reverberating effects and impacts, not just in the healthcare system. It just, it goes to show how there needs to be a cross-sector, cross-system, mindset to integrate all these approaches, because it has an impact on all other systems that interact with healthcare and on the patient. And I love the early relational health framework. Is so useful in this regard. So thank you so much, David.
Thanks, Benny. Thanks so much.
Absolutely. So I'm going to introduce next Dr. Tony Biglin. He's from the Oregon Research Institute and the founder and director of Values to Action.
There I am. Hey. So I really appreciated the last presentation. I think that in reducing the stress in early childhood for everybody in the family is critical to long-term health of all of the people involved. I'm going to talk about building nurturing communities. I'm involved in I've created an organization called Values to Action. And if I can get my slides to change, there we go. It's a nonprofit that's dedicated to involving more nurturing societies. If you've read my book, The Nurture Effect, you have some background on our thinking about how nurturance is fundamental to human well-being. We have, in the last 2 years, been working on how Values to Action can use all the evidence that we have about what people need to thrive to see if we can create greater well-being in communities. And we've focused down into communities for a number of reasons. We've come to the conclusion that the optimal way to improve well-being is to work at the community level. And one of the reasons for that is that a careful reading of the state of the political system in this country suggests that as a nation, we're in for years of conservative control of the federal government and the government of many states. And that many of the policies and programs that all of us are trying to promote are going to have a tough row to hoe in terms of getting those things adopted to the national level or even in some states. But we think that if that happens, it will be impossible to implement policies and programs that can increase nurturance at the national level or in those states. However, what we can do is support the development of more nurturing communities. And in the context of the situation in the nation, we can help to evolve islands of nurturing communities such that over time, we will have more and more communities that are models for how we can ensure the well-being of every person in those communities, and that can be a basis for rebuilding or building well beyond the society that we've ever had in this country, a society in which every person is respected and cared for and thriving. And I would add that this needs to include rural white communities, because it is the case that many of the reasons that we have so many white people with grievances that are supporting things that you and I would probably agree are not good to support is in part because the Democratic Party abandoned poor white people, especially in rural communities. So we need to be concerned about developing the well-being and nurturance in every community. So the fundamental question, I think, is what are our values? Will we be driven by the free market economic theory that if everyone pursues their own wealth, it will benefit everyone? Or will we embrace a set of pro-social values in which we seek to ensure the well-being of every person? I think our values are foundational for every problem our communities seek to address. Reducing crime, reducing conflict, preventing substance use, ensuring families' well-being, ensuring that our children thrive, addressing climate change, and reducing discrimination are just some of the things that really require us first to embrace a set of values having to do with the well-being of every person. We found it useful to pursue this in terms of what we call the PACS vision. We've stolen this from the PACS Good Behavior game, which is in about 50,000 classrooms nationwide. It's a program that establishes a nurturing environment in classrooms. And the first thing it does is it asks kids, if this were the most wonderful classroom you could imagine being in, what would you see more of? What would you hear more of? What would we be doing more of? What would you feel more of? And the kids articulate what they want to have the classroom be. They participate in it, in defining the culture that they want. And then they're asked, what would you see, hear, do, and feel less of? And they make a list of the things they want to see, hear, feel, and do less of. And this is a poster then in the classroom, but it doesn't become some dead poster that nobody ever pays attention to. It becomes something that is used every day to ask kids, well, okay, we're going to go to lunch today. So what would be some PACs, which is the positive stuff we're looking for? What would be some spleens, which is a made up word that's designed to sort of take the venom out of bad behavior. It's just behavior we don't want. And so it helps kids to participate in saying what they want to see, hear, feel, and do more of. And then a whole bunch of simple behavior influence kernels are used to promote those kinds of behaviors, and the levels of cooperation are really impressive. The decline in the rates of disruptive behavior is frequently 70–80% reductions in disruptive behavior and discipline referrals. So we thought that that might be a useful thing to do in communities. And we're working in some communities in Oregon where there's been a high level of conflict and people are angry with each other. Sound familiar? Heard of any other communities where that's the case? And so we started to, we felt we should start with what are the values of the people in the community? And so we have used this same approach and said, if this were the most wonderful community you could imagine, what would we see here, do, and feel more of? What would we see here, do, and feel less of? And that has produced a word cloud. And thus far, in a small community in Oregon, we've got about 60 people who've participated in this, but this is a community of about 20,000 people, and we're going to invite everyone to participate in this. Though I will tell you that if you compared this word cloud, where the size of the word reflects the number of people who used it, it doesn't change from the 20 people we first had do it up to the 60 people who've done it. People come together, and when you ask them in an unfettered way what is important to them, these are the kinds of things that they want. And so what we're doing now is we're asking people to, in fact, notice and thank and reinforce the kinds of things that are consistent with these values. So we're promoting behaviors that people aspire to see more of in the community. We do that by posting praise, thanks, or recognition in social media and on a website for the community. And through a participatory process, we develop goals that would advance that vision. So we're asking people in the community to say what they want to do. We are also developing action circles to work towards specific goals that advance that vision. And we are developing a similar approach to help the Congolese refugee community in Oregon essentially address the problems that they find as their greatest concern. So here are examples of the things we're doing to try and get increased recognition, attention, caring, respect for the kinds of things people are doing that are consistent with these values. The one on the left is got a QR code, and if you go to that QR code, you can go to Nurture Newburgh Moment, and you can put in a recognition of somebody who's done something. And there are also little cards we're distributing, just starting doing this, where people can, write a thank you note to someone else. This is again one of the kernels from the PAX Good Behavior game: praise, thanks, recognition, appreciation. We need to increase the positive attention to the positive things that people are doing in the community. And so much of what our work, both the work that's gotten us this far and where we're hoping to go, involves action circles. They're one strategy for addressing our many problems, and we found them useful for quite a variety of problems. Our proposition is that if you're not satisfied with the state of the world, action circles give you an opportunity to do something about it. And they consist of a small group of people who come together to advance a very specific improvement in society. And by being time limited, they give you a way to contribute to change that doesn't require you to quit your job, your education, your family, or your recreation. We have had maybe 50 or 60 people volunteer to participate in action circles over the last 18 months and produce some really wonderful products as a result. And each product we see is a foundation for the next step in resolving problems. And of course, this puts you in contact with like-minded, nurturing people. So this is our proposal to people joining the action circles. The action circles we created thus far involve increasing the use of evidence-based social emotional learning in schools. We're helping to implement the PACS Good Behavior Game in more schools. And we're also helping to implement cooperative learning, 2 programs that have been shown to significantly improve cooperation and significantly reduce the disparities in learning and disparities in terms of social relations. They significantly improve the well-being of all of the kids and reduce the degree to which kids are marginalized. We have an action circle that's developed in, an approach to increasing the use of effective reading instruction. We have one on increasing the availability of behavioral skilled personnel in healthcare, where the treatment, the diagnosis and treatment of kids with intellectual disabilities is often inadequate because the staff don't know how to handle the severe behavior problems that often arise. We've developed a guide to how you can get behaviorally skilled people into hospitals and clinics, and we're disseminating it throughout the nation. We also have developed a guide to reforming juvenile justice in your community, and we're disseminating that throughout the nation. And we are working on regulating industries whose marketing contributes to more than 1 million deaths a year. We're writing a paper that summarizes that and trying to underscore the fact that among the social determinants of health that we should be concerned about are the unregulated marketing of cigarettes and unhealthful food and alcohol and guns and pharmaceuticals, which are, I can give you the details, that accounts for about 1 million deaths a year. Those are important social determinants of health. We're also working on increasing pro-social values, norms, and behaviors in communities, as I just described. And we're working with communities on reducing greenhouse gas emissions. And last but not least, we have a social media campaign that I hope you will join at Values to Action, Defend Democracy, because there is a concerted effort to undermine democracy in this country, which is a great danger. And if you're unaware of that, go to our website, Values to Action, and you can learn more about it and why it's such a threat. So let me talk about one of these to give you a little more detail. Reducing disparities in reading skill. Effective methods of teaching reading have been identified through hundreds of studies over the past 40 years. We do know how to ensure that every person learns to read. Yet in fact, effective instructional methods have not been widely adopted. As a result, the National Assessment of Educational Progress found in 2019 that only 35% of 4th grade students were proficient in reading, while 36% lacked even basic skills. And a child who lacks basic skills in 3rd or 4th grade in reading is essentially being sentenced to academic failure and a life of poverty. It's a huge risk factor for the development of a wide range of problems. And the proportion of Black and Hispanic children who lack basic skills are higher than for other groups, 52% for Black children and 45% for Hispanic children. And so we have developed a menu of evidence-based strategies for improving reading skill. Those include educating parents and the community about the importance of reading skill, and training and consultation and effective reading instruction for teachers who aspire to improve outcomes for the children that they teach. And third, supplemental instruction in reading using evidence-based methods that are provided by community volunteers and parents. And this arises from work that we did a while back, where we showed that in a randomized trial that supplemental instruction in reading for kids in grades K through 3, where about 3/4 of the kids were Hispanic, significantly improved their decoding skills and their fluency in reading and their comprehension. And in fact, 2 years after the program had been provided, these kids were still doing better than kids who didn't get that program. So we think that this is a powerful strategy. We used teaching assistants to do that at the time, but there's now a computerized reading instruction program that's based on the principles that we used in our study. And so you don't even need to be trained in teaching reading to be able to do this. And so what we are doing now is just getting that working. There's also a book that is in widespread use called Teach Your Child to Read in 100 Easy Lessons, which is also based on direct instruction principles, and about 1 million copies of it have been sold. And this is a copy of it, and it's a little dog-eared because I used it to teach both of our sons to read. And the day came when I needed to, my wife and I took the grandkids while the kids went out for a date night. And I was supposed to put Grayson to bed, and I read him a story, say, what would you like me to read? And he pulls out this very same volume that his dad is used to teach him. That was when he was 4 years old. He's a good reader. So there are ways to do this. And we believe that if we can get this going, and we're starting to get it going in some communities, that we could have literally hundreds of communities that have action circles that are working on increasing the use of phonics-based reading instruction. So that's just one example of the way we can help communities. And if you have a community where you'd like to reduce disparities, we would be happy to talk to you about that. And perhaps that there are funds, the ESSER funds, that have been disseminated to every school district in the country, and they are earmarked for dealing with these kinds of disparities. So if you would like assistance with that, we have the expertise to train and support people in doing that. The generic features of action circles that design local action circles, the notion here is, let's figure out what are solutions to the problem and design what could be done, and then how can an action circle locally address that problem. So we identify a specific problem. We document its incidence and prevalence in the population and its deleterious consequences and its costs. Then we identify any empirically based programs, practices, or policies that have been shown to affect the problem. For example, in the reform of juvenile justice, we show the iatrogenic interventions with delinquents, and then the ones that have been shown to be effective in reducing reoffending. But more than that, we focus on prevention, that we can prevent delinquent acts in the first place. And so a heavy dose of reforming juvenile justice is a question of providing the schools and family interventions and community interventions that can reduce offending in the first place. And then our action circles indicate the additional research that would strengthen our ability to affect the problem. And then we specify interventions that could be implemented in a local community. And finally, we design a protocol for local action circles. So according to my stopwatch, I'm under 20 minutes. Hopefully, Denny will give me extra credit for that. And I'm going to stop talking. And if you would like to join Values to Action, or if you would like my slides, you can email me. And so I'm done talking. Thank you.
Thank you so much. Go ahead, Jesse.
Yeah, thank you, Tony. We did very well for the number of speakers that we had this morning, and we're looking forward to a wonderful second half. We are going to keep the brain break, this middle, very, very short for the purposes of making sure that we are able to get to everyone who is coming later on. Was not planning to do it yet, but one day, have this dream of doing an interpretive dance on one of these, but I'm a horrible dancer. So may save you all from that. But the brain break that we'll be doing today is called a whistle breath. And we'll just do this a few times as we go into this because we've all been sitting. If you need to stand, stretch, use the restroom, please feel free to do so. But a whistle breath is just where we're going to whistle on the inhale and the exhale. You don't have to do it loud. That can be disturbing to others who are around you. But it just helps for us to feel and hear our breaths, which can be very relaxing at multiple levels. And so we'll just inhale, exhale, and you can do it at any tone. I didn't mean to make those two different tones. So we'll do 5 different breaths pretty slow here, just to re-energize, ground ourselves before we head into this wonderful second half of our section. And so we're going to go inhale. One more.
Where is the Q&A question mark?
And that is where, Tony, if you go down to the bottom of your screen where chat is, you have chat, share screen, raise hand, and Q&A. You should be able to open up the Q&A right there. But so that's just a quick little brain break that we can do. You may have heard a little course with my lovely wife in the background who is joining me in that. I hope that you all got something out of that too. Again, feel free to stretch, stand, do what you need, but we are headed into a wonderful second half of this session. I am very pleased to turn this over to Dan Press to discuss Press On, which he has fortunately taken a liking to the name. Dan, I don't know if I can say that you've necessarily taken a liking to it. I'll let you sort of speak to that a little bit. But Dan is a true leader in this space, the heart and soul of so much of the work that CTIP has done, and really the visionary behind not just Press On, but also this workshop series, along with Denny, myself, Ingrid, and others. And so, Dan, I look forward and I'm grateful to be able to turn this over to you.
Thank you, Jesse, and I hope everybody is refreshed after their breathing. Press On, I grudgingly accepted, but what it's really meaning is what we've learned from these workshops is there's a tremendous desire on the part of all of you to be part of a trauma-informed community. And we've come up with 3 pieces of that for you to get involved in, to be active in the trauma-informed community on a national level. And the overarching name for that is what Jesse has called Press On. The first piece of that is a coalition, a national coalition of local and state coalitions. If we're going to be effective, we need to bring the many and growing number of local and state coalitions together to become a real force. At first, they need to be a force at the national and state level. Many of you in your local coalitions understand how difficult it is to obtain funding for your coalition. The answer is to persuade Congress to enact funding programs that make money available to local trauma-informed coalitions. If that's going to happen, it requires the coalitions to come together and become a political force. I'd make trauma-informed a national issue, just the way smoking was, and several other issues that kind of took the country by storm. Secondly, what we're hearing is desire for networking among the coalitions. So the second mission of the Coalition of Coalitions is to promote networking, so you can share your ideas, so you can support each other, so you can build each other's enthusiasm, as we've seen in the chat box. And the third initiative of the Coalition of Coalitions is technical assistance, to provide technical assistance to either startup trauma-informed coalitions or existing ones that are looking to strengthen their local or state initiatives. The National Coalition of Coalitions is an enterprise of CTIP, the National Prevention Science Coalition, and PACES Connection. The 3 organizations will be staffing the process, and we really hope to get hundreds of local coalitions signing on so that we can be a political force and a networking force. Jesse, you're going to put information in the chat box on how local coalitions can sign up for the...
So in the chat box right now, I am putting a PDF where you can find, first of all, the information that Dan is going over right now. And then also on there, there are links to sign up for the National Trauma Campaign, as well as the PACES Connection site for Press On. So yeah, Dan, it's in there.
Great. So the Coalition of Coalitions is bring together local cross-sector coalitions, programs that are bringing together representatives from different sectors in your community to work together, since no one sector can make the changes needed to make a community trauma informed. It's going to require the education, the health, the social services, the law enforcement, all the others. So cross-sector coalitions achieve that. The second initiative to create the community that you've been asking for is the creation of communities of practice. And those are sector-specific coalitions in which people involved in making their sector trauma informed can get together and share ideas from around the country. We have several of them already created. Deborah Berkey created one for healthcare systems that are in the process of becoming trauma informed and want to share ideas with each other. Becky Haas has created one for law enforcement officers. And let's see, we have Professor Dixon has created one for institutions of higher education. There are opportunities for many more communities of practice in virtually every sector, whether it's K through 12, early childhood, courts, and on and on. So if you are interested in being part of a community of practice for your sector, please contact Carlton. Jesse will again put the information in the website. I see Deborah's already put information on her initiative. This is a chance for you to share your activities, your frustrations, your challenges in the sector in which you're working with people from around the country in the same sector who are also in the process of becoming trauma informed. These are really self-operating coalitions. CTIP and PACES and NPSC aren't really going to play a major role. We're looking to the leadership of the communities of practice to make it happen. We'll be there to support you, but it's an opportunity for you to share, to be part of a community of practice in your sector, and through that, a community of trauma-informed individuals. And the third piece is the national campaign that Jesse mentioned. This is an opportunity for individuals who want to become advocates with their congressional representatives, with their state representatives. You sign up for the national campaign, and CTIP will be providing you with information on legislation that can help promote the trauma-informed community, and ask you to reach out to your congressperson, your senators, your state legislators to help advocate for that legislation. So sign up. Jesse will put information he just has in the chat box on how to join the national campaign. So there are three ways for everybody on this call, and we're so excited that the excitement these calls have created. And but there are three ways now for you to continue to be part of a trauma-informed community, following up on these workshops. If you're part of a national, you're part of a local cross-sector coalition, join the coalition of coalitions. If you're not part of a coalition, create one, because we believe cross-sector coalitions at the local level are the most effective tools for turning communities to become trauma-informed, same at the state level. So join one or create one. If that doesn't work, join a community of practice or create a community of practice in the sector you're interested in. And finally, if the third option is join the national campaign and become an advocate to get trauma-informed legislation on the agenda of Congress and your state legislatures. So these workshops will end in a couple of weeks, but we want to see the community that has been created by this workshop series continue and flourish and really achieve the goal of the workshop, which is to move the movement forward to make America a trauma-informed community. So we hope we'll be seeing all of you again after the workshop series is over, either on the Coalition of Coalitions or in the Community of Practice Network or in the national campaign. So we'll see you then. And Jesse, I hand it back to you.
Thanks, Dan. So yeah, we're thrilled about the growing team and the coordination that we all have. Please reach out to Carlton. I put his email in the chat. He is here to support you. I know that on the Paces Connection side, Matt, who spoke earlier, and others on those teams are here to support as well. We want to be here to support you as we build this movement from the bottom, a strong foundation that enables us to continue to grow moving forward. So thank you, Dan. And I will quickly segue over to Ingrid Cochran to discuss the platform that Paces Connection has created for promoting communities as well.
Thank you, Jesse. I hope everyone can hear me. I'm going to share screen. Let's see. So we've heard a lot of information today, and I think it was very exciting. This presentation today has really been very helpful, and also really helping to all of us to help center all of us around community being the way to really make changes and bolster our well-being, our mental health. And I do want to thank everyone for joining us today. And really what I want to talk about is how we can move this movement forward and how Paces Connection can be of support. In the discussion that we've had, several people have brought up over and over again the importance of these different coalitions and initiatives. Obviously, Dan just talked about, the coalition of coalitions, that we're creating. And we had definitely a really strong talk around public and private partnerships, what it means to have trauma-informed workplaces, trauma-informed initiatives in schools, creating learning collaboratives, definitely having place-based community initiatives. And probably my favorite today was Mr. Biglin with Values to Action. I really connected with his presentation, and I really appreciated his comment around being very specific with tackling issues that white rural communities are dealing with. As a Tennessean, most of my health equity work in this space with hospitals, and Nashville is a hospital hub really, has really been around rural communities and the disparities they are encountering. And what I found in my work is we often, when we're explicit about race, we often will talk around communities of color without including all groups that are experiencing disparities and experiencing trauma and other ways that their resilience is being impacted. So I really appreciated Values to Action and their work. And so today I want to really talk about how Paces Connection can be a support to the many movements that are going on, and also support to individuals who are interested in starting a movement. And so we have, again, the really clear focus on Paces science. Paces Connection has been around since 2012. And so we've really done a lot of work around how we support communities and what really is important in our work. And so again, these 5 pillars that Matthew Portell spoke to at the beginning of this program are really what we focus on in our work at Paces Connection. We are really looking to use Paces science to solve our most intractable problems. And of course, on our site, we support around 430 communities currently, city, county, and state level. We also have international communities, and we also have interest-based communities. So for those who are looking to start communities of practice, we can definitely support you in having a space for you on our site. Currently, we have over 55,000 members. And again, that membership is growing daily. So we definitely want you to join us. And as we look to the future with Paces Connection, I have just taken over as CEO this year in January. And my focus the priorities that we have set forward as we move forward in the next 3 to 5 years is really about focusing on equity and being healing centered, especially for groups who have experienced historical trauma, intergenerational trauma, systemic issues like racism and sexism. We want to focus on collective hope. Obviously, we want to bring forward more information and understanding around PCEs or positive childhood experiences and how we can use our understanding of the science to create positive childhood experiences for people as prevention or as a buffer against the trauma that they are experiencing currently or historically. We also want to address the collective traumas of the time, which are the COVID-19 pandemic and our current climate crisis. And so as we tackle these big problems, we want to be able to have a clear narrative around how these collective traumas are impacting us, but also bringing forward the understanding that when we are dealing with stress and trauma, even in a collective manner, it has real impact on all of our sectors, the schools, law enforcement, our medical, obviously medical when it comes to COVID-19, but that now we also have an area where we have a very clear understanding of the real impact that toxic stress can have on everyone. And so in these times when we're dealing with the collective trauma, hopefully those of you who have not experienced toxic stress ongoing, who have not experienced the allostatic load of poverty or the allostatic load of racism or living with a disability, that you now have a better understanding, maybe have bolstered your empathy when it comes to the real impact and the daily toll of dealing with toxic stress. And so as we move forward and we think through what we want to tackle in the coming years, first, we have a call to action that you become a member. Our website is www.pacesconnection.com. And we want our members to be able to connect with each other. We have members from all across the world, and we want them to have access to our resources. We have an awesome resource center. And we have a collection of resources that is probably one of the most extensive collection of trauma and resilience resources online. Also, we want people to start a movement. As we've clearly stated, community is where healing happens. And so we want you to join an existing community that may be in your area geographically, or a community of practice. Or we want you to really consider starting your own, as hopefully this presentation today has really helped you to think through if you have the passion and desire to start your own. In addition to that, we provide consulting services to assist initiatives in what they are really struggling with the most. And that could be a lot of things. There are a lot of initiatives that are really struggling with diversifying and having DEI within their movement. There are a lot of initiatives that are struggling with member engagement, parent engagement. We're able to help in all of those aspects when it comes to how we organize and move forward, and also how we sustain our movements over time. So if you have any questions, that is our email for starting a movement or having access to any of our services. We have also added some clear benefits from the standpoint of how we can assist you in your movement. First, if you are a part of a community, your community has a free website. This service allows you to raise your visibility. It provides a place online for you to commune. We have over 400 other communities. So that connection is very important. It connects you with funders, it connects you with other relationships. You get to see who's doing what, where, and if it's working, if it's not working, and you can see other people's struggles and their successes. So those relationship building opportunities are probably the biggest benefit of being a part of PACES Connection. And then that increased visibility that we have through our mapping of the movement. This allows for anyone in the world to pull up a map and say, I'm interested in what's going on in Oregon. I'm interested in what's going on in Texas. And they can zoom in and see your initiative wherever you are and connect with you. One of the things that I've been most interested in, especially in my personal journey as being a volunteer in an ACEs initiative before I became an employee of PACES Connection, what I found was, as an individual, when I went into these spaces to volunteer my time, I was often met with resistance, and that resistance can come from many places. But and this is kind of the things that we don't want to talk about when we talk about collective impact work or collaborations, that we do have to do the work of power sharing and engaging members and creating spaces for members to come and also be heard and have equal power in your initiative. And I encountered that not being the case when I attempted to be involved in an initiative. And so this led me to believe that there's a lot of need for an understanding of how to work together. Because when we look at the trauma initiatives, resilience initiatives, we're talking about communities. And we live in a polarizing time. And so when we think about tackling all of the issues that communities need to tackle, racism, discrimination, health disparities, and of course, adversity in childhood, there's a lot there that comes to the table that people need to grapple with. And in order to do that, you have to have first everyone at the table, and you need to be able to have difficult conversations. And so our accelerator program, Creating Resilient Communities, is individually focused for people who are looking to address issues in their communities, but may not know exactly how to do it or feel inadequate in the spaces where you have representatives from a medical center or representatives from a health department or the chief of police in the space. And so how do I interact with this group? What do I bring to the table? And so this program is really helping people to understand how to organize, to understand root cause. And as you can see this information here, and it also has a list of kind of some of our courses. That list is not exhaustive, so there will be other courses added, and but this is really just to give you a good understanding of this program. This program is free to any individual who's interested. And again, if you are interested, I have the contact information for you. Let's see. The benefits is obviously networking opportunities, access to our services and our site, and also volunteer matching. If you are interested in being involved in this, I will have contact information for you as we follow up on this presentation. Another free program that we've always had is our Growing Resilient Communities. And this is for established communities who are looking to really grow in their work. We have 5 tenets, which is to educate your community, to aggregate data, to tell a story, to engage your members, to activate your community, especially your policymakers, legislators, and your community leaders, and then to celebrate you. So as you have successes, that you celebrate those successes, you celebrate your members, you celebrate your leadership. And so this is another free program that is for communities that are already existing and are really just looking to dive into the work. And of course, the benefits are, again, you have a free website, you have that visibility from the mapping the movement, and you have free training that goes along with that to help you to build strategic partnerships, to develop your leadership, and definitely to address issues of diversity, equity, and inclusion. Let's see. And then we have our last level. This is an additional service that has been added recently, but these are our paid services. One that stands out the most is going to be our cooperative of communities. We also provide consulting services. But these services are for communities who are very established and are looking to maintain and sustain their movements. And so as you can see here, we're looking for movements that are at least 6 months old, have at least 4 sectors involved, and really are looking to sustain their movement over time and get the type of leadership and facilitation and learning collaboratives that allow for them to be very clear about their mission, to help to establish partnerships, and to really do the work of systems transformation. And so here are some of the benefits of that Cooperative of Communities program. And there are other programs coming with the Sustaining Resilient Community Space. And so we have, this is our transitional year where we are piloting a lot of things as I transition into this role. And so we want to let you know that we are available to you as you decide to either start an initiative, to maintain one, to grow yours, to push for sustainability and more funding. And if you are interested, here's our contact information, and I'll be sure to look into the chat to see if we have any, and I will also add more information to the chat as well. And thank you for your time.
Thanks so much, Ingrid. Incredible information. And again, in terms of helping to grow communities, certainly encourage folks to go over to PACES and engage with these resources as they can. In addition to introducing our new staff member, Carlton, a bit earlier, our Director of Community Engagement, I'm very excited to introduce as well our new Director of Government Affairs, Jen Kurt, who is coming to CTIP from Congresswoman Ayanna Presley's office. They help to lead community funding projects, also known as earmarks, and are here to sort of help folks understand how to get some of that funding. So Jen, thank you for being with us. Turn it over to you.
Thanks so much, Jesse. Can you all hear me okay?
Yeah, you're coming through.
Awesome. Good afternoon, everyone. It's great to be with you all. Great to meet you. Excited to join CTIP. And let me share my screen here. I'm just confirming that this is in slideshow view. Awesome. Okay, great. So as Jesse mentioned, I wanted to talk with you all about community project funding today, also known as earmarks. You know, as these presentations described today, you all do incredible work, but it is often underfunded. And so to the extent that we can help you to receive federal funding that is available, at CTIP, we want to be a resource and help make that happen. And so one of those opportunities is through community project funding. And community project funding is an opportunity for you, or if you're not eligible, an eligible partner, to receive funding for an eligible project that you're working on directly through the annual government funding bill or the appropriations bill. So instead of applying for funding through the state or through an agency, you will get your program funded directly through the federal annual funding bill. But your representative or senator must make the request on your behalf to the Appropriations Committee. So in the presentation, I have a ton of content to cover and not a lot of time. But we're going to talk about what eligible projects are. So we'll talk about the available accounts you can apply under, who are eligible recipients, and then the new guardrails that have been included to prevent corruption. Earmarks were done away with for 10 years and brought back last year with these new guardrails to protect from some of that corruption that eliminated the program to begin with. I'll give some examples of programs that were funded in FY22, make some suggestions from my experience running the process as a staff member on the Hill. And then I have a special guest coming in to talk a little bit more about the politics of it and some tips for making a strong application. The deadlines, the first deadlines are coming up. And so the process is originating in the House, and then the Senate will originate their process in their chamber as well. But House members, your members of Congress, have to submit their community project request to the Appropriations Committee for their consideration, either on April 27th, 28th, or 29th, depending on the account. And so working backwards from that, they're going to require you, the project applicant, to submit your applications to them within the next 2 weeks. Some deadlines could be as early as next week, some could be the following week. And you will want to check your member's website or reach out to their office via phone call to get information about the application. Usually it's a Google form and their deadlines. And if you need help with that, we can help you get in touch with your member. And then in the near future, the Senate will have their process as well, and you can submit the same project to your senator. Oftentimes when they both request the same project, that improves your chances of getting your project funded in the final bill. After the House and the Senate both pass their bills, those will be conferenced, and then hopefully the FY23 bill will pass with your project in it. I mentioned some of those guardrails. So some of the evaluation criteria in the House, each member can only submit 15 requests. Last year it was 10, this year it's 15. In the Senate, they're a little bit less selective because they don't have a limit. Your member has to certify that they have no financial stake in the project, neither does any member of their immediate family. They have to demonstrate that there is robust community support. So this is not just a pet project for the member. There is evidence that this is needed, it will impact a lot of people, and you're going to be required to provide that information. So press clips, minutes from any community meetings. Did your state say that they want to put some money behind this issue? Your town or city government can pass a resolution of support for it, things like that. There is a ban on for-profit recipients. In 99.999% of cases, for-profits cannot receive community project funding. For some accounts, there are matching requirements, so Congress can provide 95% and your state must match the 5%, so you need to keep an eye out for that. This funding is not for a 10-year project, it has to be obligated in 1 year, in that fiscal year. And then the amounts you can request, Congress is providing no more than 1% of their discretionary funding for earmarks. And so members last year were told they would get $3 million across all their earmarks, but many members actually didn't put forward any earmarks. And so that average was around 10 to 15 million, I would say, per member. And so yours would be, a section of that pot, and projects range anywhere from like $18,000 to 2.5 million, maybe a little bit more, but usually they're around, less than 1 million. The accounts are kind of like grant programs, which have parameters for what you can use the funding for. And I'm going to go into some examples of them that might be pick out the ones that might be of most interest to you all. But the Appropriations Committee is broken down into 12 different subcommittees, and each subcommittee covers the funding for certain federal agencies. 10 of those subcommittees have accounts that you can apply for community project funding under. You might be interested in the MILCON, Military Construction and Veteran Affairs, for veterans mental health. The Agriculture Subcommittee has some telehealth in there. Commerce, Justice, Science has some funding around police and juvenile justice. But I think most of you are going to be interested in the accounts under the Labor, Health, and Human Services Subcommittee. And the deadlines for members to submit are coming up April 27th. Here's the full list of accounts available under the Labor, Health, and Human Services Subcommittee. And there are 4 with asterisks that I'm going to provide a little bit more information on in the next slide. But I will say we do have a link to a longer PDF where I put a ton more information about each of these accounts, and we can share that in the chat as well. I will also say that I host office hours every Monday from 12 to 2 p.m. Eastern. I'm happy to go over all of this all over again or provide some technical assistance on your applications, and we can get to that a little bit more later. I have broken every rule about how many words you should put on a PowerPoint slide with these slides, but there's so much important information here. So one of the accounts that I think you'll be really interested in is the SAMHSA account. Really broad uses in this account, generally for resources to address substance use or mental health services. This is prevention, treatment, recovery support, paying peer support specialists, doing outreach, case management, suicide prevention activities, providing education materials around substance use, HIV prevention, hiring more behavioral health providers at your organization. It can't be used for inpatient treatment or detox, direct payments to patients to incentivize entering treatment, food expenses, research projects, or construction. I'm including the general amount that they are funded at last year. And higher amounts are possible once the subcommittee receives all of the requests. They're going to divide it up and they can provide maybe higher funding levels, but generally not higher than $2 million. And this is going to be best for those nonprofit treatment centers, community-based nonprofits that do that kind of mental health outreach, trauma services, local public health agencies. The HRSA account, this is really, you want to think about this as like construction, acquiring equipment, and then training professionals. And but they can't be used for, paying salary or buying, your buildings that you want to house your nonprofit in. But if you want to, I got a $1 million earmark for my boss last Congress to build 26 more beds in a substance use disorder clinic. So they expanded and they constructed a new wing so that they could provide additional beds. This is going to be best for your nonprofit hospitals, your mental health centers, even schools that teach medicine, medical research labs. Administration of Children and Families, 2 more. So this is the second to last that I'll highlight. 2 buckets here, child abuse prevention uses. So this is around, improving the prevention, assessment, identification of, and treatment of child abuse. You'll want to target high-risk children and families with your project. And then the second one, social services, research and demonstration, promoting the ability of families to thrive through financial self-sufficiency. This is great for nonprofit, any community outreach organizations, faith-based organizations. And then the final one that I wanted to highlight for you all, this one's going to be good for state and local education agencies and any local education related nonprofits. And you can use this money to do any kind of teacher training, social emotional learning activities, early intervention services for infants and toddlers. So really thinking about how do we educate communities about the issues that we care about, catered to K through 12. And you can't use this for construction or renovation in most cases. Here are some examples. I have a long list of examples in that PDF that we can provide you the link to, but here are some examples of projects that were funded under these accounts in the last Congress. So you have Congressman Buchanan, who's a Republican from Florida, pilot program for a trauma intervention model to address child welfare, to work with their child welfare program, partner with a local resource center. Congresswoman Bush got the City of St. Louis Mental Health Board of Trustees some money to create trauma prevention services for people impacted by gun violence. Congressman Chuy Garcia got a Gads Hill Center, a local community center, some money to expand trauma-informed services across Chicago's South and Southwest sides. Included in this is therapy, group therapy, home visits, teletherapy, case management. We have Congressman Norcross, who got another local center some money to educate and empower residents around addressing ACEs. Senator Collins from Maine, some money for construction of a new facility to provide residential substance use disorder treatment. And in the education account, we have Speaker of the House Pelosi, Senator Padilla got some money for Futures Without Violence to do some outreach on trauma-informed social emotional learning programs for students. A few suggestions for me before I bring in our special guest. One, when you're thinking about making your application, making your ask, research your members' priorities and tailor your language based on the kind of language they use to talk about your issues. If they chose to submit in FY22 You'll want to review those requests. They're listed on their website as required, and use that as a guide for how you want to talk about it and what kind of things that your member cares about. You'll want to request a meeting with staff. If you can get a meeting, that's great. You'll want to emphasize building trust with them. You'll emphasize how much community support your project has and the benefit to their member and to the community. If you don't have a project eligible that you're working on, you can reach out to a nonprofit partner or a local government entity and encourage them to apply. And then of course, keep us updated on your progress and your success. You know, when I was doing this process and fielding applications working on the Hill, I saw that the applicants who had lobbyists and could afford, you know, grant writers in-house had these incredible applications, but some of those like smaller organizations that need the money the most just couldn't get there on their own. So I spent a lot of time working with them, but a lot of offices just don't have that capacity. So if I can do that to help you, I'm happy to make the time. You know, you can reach out to me at this email and attend my office hours, or we can find some other time to chat. And at this point, I want to invite Denise. We have a few more minutes here for a conversation. Denise Fleming is a friend of mine. She recently left the Hill after working there for 10 years. Most recently, she served Congresswoman Cindy Axne from Iowa as her legislative director. So she also managed this process for her boss, for her former boss, and can share some of her perspectives. So thanks for joining us, Denise. And the first question I have for you is, how many applications did you receive for community projects? And how much time did you spend reviewing each one of them?
Yeah, thanks, Jen. My office received about 60 applications, and not all of them got equal review time. You know, I did review every single one, and I think this is true across most congressional offices, but you have certainly one person who is the lead and doing all. It's very hard to delegate this to multiple staffers, so you sort of have one person. And so, you know, I would review all the applications that came in, but if I found noticeable errors or problems, I essentially set that application aside and focused much more of my time on the applications that were complete or very close to complete.
Got it. It's a harsh reality for some of these organizations, but it's just staff don't really have all the time in the world for this, unfortunately. So tell me which applications stood out and what were some of the poison pills in applications? You know, which applications did you read and why did you say, oh, this is a good one, let me put in this in the maybe pile? And why did you put some in the, you know, let's just, you know, avoid this one pile?
Yeah, you know, it was easy to tell which applications had been applying for whether it was government grants or private money, because they had really polished, really simple materials where you could quickly read and understand. They had graphics and charts and photos and, you know, before and after. And those applications not only were polished and readable, but I think you have to remember that the staffer who is working on your applications, you know, the congressman's office was lucky because I am in my 30s and was doing this, but you may be working with somebody who's 25 who doesn't understand, you know, what it is that you're trying to advocate for. And so having an application that speaks clearly to a broad audience is incredibly helpful. You know, I also got applications that were just words, just text. And so those applications are really difficult, especially if they submitted them in like a PDF form, because then sometimes I couldn't even keyword search, and it just required like an intense amount of reading and searching. And of course, in order to vet all applications equally, it meant I had to vet everybody on the same merits. And so when I got a completed, you know, box check every single thing that was on the application form submitted by our airport, it meant that I had to consider the application seriousness, whereas an application that I got from a nonprofit who had a good idea, but it was basically just a couple pages of just text about what they, you know, wanted to happen in terms of work that I needed to do and who could cross the finish line on deadline and actually, you know, be able to receive and use this funding. It was a clear choice, you know, in this case, the airport had to be the winner there.
Yeah, that makes sense. I will say in the office that I was working for, I worked for a member who was on the progressive side, a very safe Democrat in a very blue district. And some of the things we had kept in mind was we wanted it to be geographically diverse. So we didn't want all of the projects to be right in the urban hub. We wanted to spread it out across the district. And we also wanted to make sure it was a good use of money to meet the moment. So we wanted to make sure that, you know, we were hitting upon some of the real big pain points in our communities, partially to shield ourselves from any criticism of like, you know, why are you giving money to a new walking trail, you know, in the park when people are experiencing homelessness, right? So we really wanted to target like those the greatest needs. But I understand that, you know, you worked for a member of Congress who was a moderate Democrat and represents a Republican district. So she was sort of holding on by a bit of a hair in her district. And so what are some of the additional considerations that you had to make, and any advice you have for people who want to apply for community project funding and their member might be more on the conservative side? Any suggestions around you know, why you make the decisions you make because of the, you know, somewhat ugly political realities, and what are some tips that you can provide on that as well?
Yeah, I mean, for my boss represented an R+2 district, which means that Republicans typically win by about 2 percentage points. And so, you know, we knew that even participating in the process, submitting what our earmark requests, opens the Congress member up to political attacks. You know, earmarks have always been criticized as, you know, taxpayer fraud, waste, and abuse. And so we had to vet every project, not just to see if they met the requirements. And actually, Jen, you touched on it. One thing I wasn't expecting that I saw after the fact was a lot of members chose to submit projects geographically and regionally. You know, my member represented a district that was 16 counties. And so it was really important to us that we had one urban center, Des Moines. And it was really important to us that we didn't just submit all the projects for Des Moines. We wanted to spread things across the district, which I saw happen a lot in more congressional offices, which means that if you are located in an urban center, you're not competing for slots 1 through 10 of submission, you're competing for like 2 or 3 slots from that urban center. And so, you know, that seems to be a strategy to help avoid criticism. You know, we don't want the Congress member to be criticized as favoring or playing politics with, you know, nonpartisan money. And so we also had to look at each project in terms of, you know, we did the headline test, right? Like, would we be attacked for supporting this proposal or this project? And, you know, there were some applications that, while, you know, well-intentioned, wouldn't have met that test. It would have been skewed or turned as this is a huge waste of taxpayer dollars. You know, another thing we had to be really cautious about was any even, you know, possible whiff of conflict of interest. There was someone who applied for this funding through our office, but they had a relationship. They're not like best friends, but they're close to the congresswoman, and we had to decline their request because we didn't want even the air of attack. And we also needed to make sure that the projects we submitted and got could uphold that message, could say like, yes, you know, the congressmember did this in a way that was nonpartisan, and, you know, it had nothing to do with relationships or who voted for who, and even putting it in places where we didn't have the most Republican support or the most, you know, like we didn't have a lot of support there. That was important to the office to demonstrate that we were doing as, you know, as equitably as possible. And so we almost inverted the process, right? Like, we were very cautious and we only were interested in projects that could meet this very high level, as opposed to what I think most people think happened, where we're vetting everybody on an equal playing field. We're actually much more protective, and we're really looking for any reason that, you know, this might be in the worst interest of the congresswoman. And I would say we were pretty successful. We got 9 out of our 10 requests. Not as successful as Jen, who was able to get 10 of 10 for their members' requests. But it was a strategy that really paid off. And what's going to happen for my Congress member is, I don't work for her anymore. She will be able to go to places a water facility, treatment plants, and a childcare center. And the local headline will say, Congressmember gets money for this local community project. And that was always the intention. That was always the ultimate goal of submitting these projects.
Yeah, I think the reality that, a lot of this it's a combination between wanting to fund, the members and the staff wanting to fund good projects that have a really strong impact, and also just the politics of it, right? You want a project that's going to benefit the most voters possible, the most constituents, but they are voters possible. You want that visual of the member cutting the ribbon, as you mentioned, and you want something that's going to be, align on messaging with how the member messages things. So can you talk a little bit, I think we only have a couple minutes left here, but can you talk a little bit about, what role does trust play in this, and how does that relate to messaging and politics and things like that? And I wanted to underline the thing you said about, the person reviewing the applications doesn't have a process in mind. Like, you just have this 27-year-old person who's just has 10 hours to work on this, really. And so it's yes, no, yes, no. And sometimes we can get so in the weeds with our language and the way we talk about things, but we really have to simplify it. Where we want to talk really deep about ACEs, we need to talk about mental health. We need to talk about suicide prevention, things that people can understand really simply. So yeah, my sort of open-ended question about the trust in messaging, and we can, end it there after that.
Yeah, I don't think we submitted any projects that we didn't already have some level of familiarity with. Maybe it was a city, maybe it was, whatever it was that we submitted, we had met with that organization in some capacity prior. And that's really important, one, because, especially in our official capacity, might I say, I don't know if this is relevant, but a lot of people think that the campaign work and I volunteered on your congressman's campaign, so you should do this for me on policy. Totally against ethics rules, cannot do it. Don't even mention it, because we'll throw your application right out the window because it's a violation of our ethics rules. And so, having your member of Congress come tour your facility, sit down with your members, some sort of official interaction to introduce yourself to the staff and to the office. It conceptualizes, who this piece of paper is to the staffer. But two, then, we begin to build that relationship. And, we wanted folks who could stay on message with us. It's really important. Like I mentioned earlier, if you get an attack from, because you submitted a project request, you want to make sure that your, nonprofit or your childcare center can say and stay on message with you, no, the Congresswoman's office did this in a way that was very equitable and very fair, and really work with us. And so, that's the type of partnership we're looking for, because I think one of the worst case situations for our office would have been, we think this is going to be a mental health supporting something over here, and then the organization is over here talking about it with really, with different language. And so it doesn't appear that we understand or on the same page. And when it comes time for the press to get involved, suddenly we're talking about different things. And so really making sure that, we know exactly what this is and exactly who you are, and how to talk to you is important. And what else about the trust process? I mean, I had somebody I didn't trust submit an application. I had a bad experience with them, and it was unfortunate for that organization who chose to work with that lobbyist, and they didn't know that. But I wonder if they had checked in with some organization like CTIP and Jen, would they have had a better application, as opposed to just trusting this longtime lobbyist who they didn't know, actually had burned a couple bridges. So, unfortunately, politics are always at play. So, that's another thing I would recommend, is just have folks review your application and, talk to people who are not just in your bubble, because I see it happen all the time where, we just sort of spin each other up, and, we're just talking to the same people. It's an echo chamber. But when it comes to the application, it has to be so tight, it has to be so on message. But I think it's helpful to have, multiple people take a look, which is why I wish more organizations had a Jen when they were submitting, because I got a lot of folks who could have used that type of experience. And unfortunately, their application just wasn't complete or it didn't hit the messaging for our office. And, I didn't go back to those offices then and say, change it. We didn't have time. I had to just find the 10 that worked. And so that's, if I may make one more point, Jen, that's maybe a final point, but when you submit the application, that's the final application. Assume that is, I got a lot of people who are like, if you have any questions, just call me. And it's like, I didn't have time. We've had the deadline and a week later we had to submit. And I had to spend all of that time getting the projects that were, inches away from the finish line up and running. I didn't have time to reach out and understand more or get more documentation. And I think a lot of folks thought the application process was like a vetting or like a first step process, but it's actually the final. It's the final process. And that's maybe one of the big it was a new process we were all learning, but that's one of the things I hope we learned from the experiences. There's no spare time. Being a congressional staffer, there are no extra minutes in the day. And so that application, when you hit send, just has to be ready to go.
Thanks, Denise. Yeah, I would say in closing that I think we both wish Congress were more trauma informed and had an equity lens and functional processes and more time and better, flexibility to create these relationships. But I think what we're trying to convey today is just the reality of it all and the unfortunate reality of the time constraints, the political constraints, and how hard it is to for underfunded organizations to create a really compelling application. And so to the extent that I can be helpful to any of you who plan to apply, please use me and use CTIP as a resource. Jesse put my email in the chat. Again, I do office hours every week. Happy to be helpful. So thanks for the workshop, for your time. Thanks again, Denise, and I'll turn it back over to Jesse.
Thank you both so much. Denise, first of all, just want to say thank you. And 9 out of 10 is still an A in our book. We're not grading on a curve here. So very much appreciated. But to what Denise said, and, others have said this, the best possible scenario is to have a team of people smarter than you. And I am so fortunate to be in that situation where you just heard how Jen and Denise were able to have a candid conversation, which was so appreciated in the chat about community funding projects. Really quickly in the chat, I am putting again the PDF that Jen put together about the CF or community project funding, rather. I keep saying it wrong. My bad there. But in addition, another very, very wise and smart person that I have the sincere pleasure of being on a team with is Laura Porter. Many of you may know her from her work with the Family Policy Council in Washington State, authoring the Self-Healing Communities model, and her work with ACE Interface with Dr. Rob Anda that she does around the country. And so Laura, if you're able to hop on the video, I'll turn the floor over to you. And in the meantime, just mention one more time that Jen is having office hours from 12 to 2 on Monday. Keep an eye on CTIP social media. If you want, you can reach out to Jen, you can reach out to me, and we'll make sure to get you the link, and we hope to see you there. But Laura, look forward to turning it over to you.
Jesse, the host stopped my video, so one of you has to turn it back on.
Jenny, are you able to help with that?
Her video, yes. Let's see. I'm gonna ask
That should work.
Hi, Laura.
Let's see. I'm just gonna pull that up. Okay. My video is already on, so I'm gonna ignore that last bulletin.
Laura, before you get too started, we're having a pretty severe echo.
She has to back because she's on both, and so you need to go to your Zoom platform, and next to mute, the up arrow is take it off of audio.
Okay.
Just try that.
Never heard that before. Kind of reminds me of those microphones that I used when I was a kid that like automatically amplified the voice.
confused about that. So if I mute, then you.
So do you have your phone on? Is that what you're talking through? I can't hear you now.
No, just through my computer audio. I don't have any other device on.
Have another device on. Well, I don't know why it is echoing really badly.
Laura, do you want to try logging back on very
Yeah.
Sure.
quickly and see?
Yeah.
All right.
Sure.
As Laura does that, and yeah, Astrid, I was on mute for a bit and agree that Laura was definitely ready for karaoke. We'll try this again. Worst comes to worst. We'll have it with a little bit of an echo. I didn't think that it was that terrible to understand, not ideal for sure, but just wanted to share this link about the American Rescue Plan Act funding. Denny and I were going to speak about some other federal funding, but there wasn't enough time in today's session, but there's also funding available through the American Rescue Plan Act, and you can find more information about that there. Laura, see you're back on.
Yeah, let's see if I'm echoing now.
No.
It's still echoing, but we'll just go ahead with it. Folks are
Great.
saying you're ready for karaoke. We could still understand you.
Okay.
Are you on two Zoom platforms?
No,
Just one? Nothing in the background? No Zoom,
I'm looking.
still open in the background?
Just closing everything else in case there's something I don't understand.
Nah, you're good.
I don't know.
All right, it's, I guess we'll go ahead, maybe lower your volume a little bit, has been suggested. Just,
Okay.
we won't get rid of the echo, but it is coming through really loudly and maybe it won't be so obvious. So go ahead. Oh, now now you're muted or something. You might want to turn it up just a little bit more. We don't hear you. Did you turn your volume off on your laptop? Oh, darn. Do you want to, are you able to call in on your phone? There's all kinds of options in this technology world.
It's fascinating. 2 years of like Zoom life, and I think that we all thought that we had seen it all. We continue to learn new things every day. Laura recognized that this is probably a bit frustrating, but excited. Yep, just this is good for anybody who may be in a moment like this. Good time for whistle breaths or any of the other brain breaks that are quick and easy to help regulate, as Laura's calling back in.
Fortunately,
Reconnecting to audio. CTIP social media, you can just look up CTIP, Facebook, Instagram, and LinkedIn, and Twitter, CTIP.org or Campaign for Trauma Informed Policy and Practice. For what I just saw in the chat.
Hear me now?
Oh, Laura, that's perfect. Yeah.
Okay. The phone is the mystery object.
There we go. All right. We'll go off camera and on mute.
Okay,
Back
so
over to
Jesse
you.
and
Thank you.
then asked me to talk a little bit about some practical aspects of creating a coalition and making a successful coalition. I'm just gonna see if I can talk basically for 15 minutes or so. I don't want to take you over time if I can avoid it. But I want to open just by talking about this word coalesce. Coalesce means to grow together, and think of it as we're uniting people toward a common goal, but we're doing it through learning and growth. And so a coalition is put together for a specific reason. We might want to put one together for creating a healing-centered community, but that's pretty abstract. Coalitions usually come together because there's some significant need in the community or in the interest group. And then they go on a journey together to learn together. And so we have to think of coalitions like we think of communities. They're living systems. We need to stay nimble, stay in touch with who is engaged and who we might want to be engaged. So when we're thinking about growing together, what are we growing? We're growing the capacity to solve problems, which means we've got to build into our coalition development some civic skill building, some building of and modeling healthy relationships and trauma-informed ways of interacting with human beings inside of the group or the community. And then the ability to identify and activate really right fit situations and honestly evaluate success. And these are pretty rare. This set of skills you won't find in everyone who would like to start a coalition. So in part, what you're going to do is think about your own skills and think about who you need to be on a core team. I think of it the group that you huddle with, the group that you might have a breakfast meeting with once a week and figure out what's our strategy, where are we headed for, and make sure you're getting a group of people with a constellation of skills that will include being able to build the skills of others. You're going to build processes that are trustworthy, and that means that when you say you're going to do something, you do it, and that you put regular and systematic times in place for your action, that people can relate to you. Even people who don't easily trust others begin to understand that they can trust your process. And that's really vital for coalition building. You want to be able to co-create innovation. And so you want to be able to recruit and talk with people who are excited about innovation, want change. And then lastly, we're trying to grow the ability to lead a learning system, that we are leading organizations to be able to grow and change and learn and adjust to their policies and practices. So these are kind of big goals that are often not talked about coalition, that we're not just a group of people that comes into a meeting to set an outcome as a goal and then we achieve it. We're actually going to build the opportunity for growth and learning together. And most communities don't have much opportunity for that. So if you use people's time wisely in developing these skills and abilities, they'll find your coalition work to be valuable in their professional lives and their personal lives. Now, I really rely heavily on systems thinking tools. I just want to introduce one simple one. Many of you may know about it, but it's the systems thinking iceberg. And the idea here is, like an iceberg, we see a small part of reality. And those are the events that we can see in everyday life. But what's below the waterline is really actually pretty powerful. We're talking about making change. So there's patterns that some people are great at seeing patterns, other people are not as great. There are structures, mental models, values, and principles. So the idea here is that our values and principles are driving our mental models. Our mental models are a belief about the truth. And those beliefs about the truth are driving the structures we create, including things like when Tony was talking about learning circles and innovation kinds of work. So the structures we create include not only the organizational structures, but also who talks to whom in a community, in a coalition, et cetera. And the structures we create drive the patterns and the events that we can see. And we get more lasting change if we focus our coalition building and our skill building below the waterline. If we're challenging people around these issues of our values and principles, and if we're challenging the ways our thinking might be keeping the community stuck. And so I'm going to come back to that in a couple of minutes about your focus of effort really matters. But first I want to talk about fuel for change. So I've introduced over the systems thinking iceberg some ideas about how coalitions often focus their efforts. And the first fuel that I often see people use for change is they're trying to address a shared threat. and they will use anger as a fuel. And often, and especially in communities where there have been longstanding injustices, anger is a very easy fuel to reach to, but it is a short-term fuel. It doesn't tend to make very lasting change. And I'll tell a little story in just a second about me using anger as a young organizer in my community. But below the waterline, having shared goals or targets, shared objectives, below that and driving those shared objectives are our desire for social and practice improvement. And these require different kinds of fuel for change. When we're working with people, we're trying to get them to have some shared goals or shared practice improvement. We often are dealing with ambition as a primary fuel for change, and exciting them about the potential for making a difference in their community. Another fuel for change is story. And when we want to engage people's sense of vision, their creativity, their hope, we can often use story as fuel for starting a coalition, for engaging a coalition, and for keeping it rolling. And then lastly, and probably the most powerful type of fuel for change is really about shared identity. Who do we want to be? What is our legacy? What do we want to leave the world with? But that fuel is a little difficult to use at the beginning. So we tend to use these top three at the beginning. But I want to just quickly say that in my early community organizing career, there was a lot of anger in the community where I lived. And the anger was about high utility bills. People were furious about paying too much for their electricity. And it was easy to get hundreds of people to show up and storm the auditorium and yell and shout and stand up and threaten and all of the things you see when anger is used as a way of organizing people. And during that time, I was young. I hadn't done a lot of community organizing. I certainly hadn't organized a lot of coalitions yet in my life. And I thought, this is great. Look at all the energy there is for organizing. We can use that. And we did. We actually recalled 2 elected officials from office and elected 2 other people into those positions. So it can be a very effective fuel. You can get rapid change, but you can't expect to get really lasting change. So use that fuel only when you want to create a coalition for a short-term goal, and when you're prepared to navigate all of the complications that come from that fuel. But also at the same time, you should be thinking about how are you going to layer in these other kinds of fuels so that you don't get stuck at the end of that getting your short-term goals met, but still having all of this anxiety and free-floating anger in your community. That's not what you're trying to create. It certainly doesn't create a healing-centered community. And looking back on that time, I probably wish I would have used a different fuel for creating the coalitions we did create. But using this notion of ambition, this notion of we can really make the change, we need to work together to do it, and using story can be very powerful. And in the end, when we make big changes, we can evoke those other fuels for change. And so use your breakfast club, use your huddle group to think about what is the fuel we're using for change, and how do we use fuel that has a more lasting impact, like ambition, story, or identity. So I want to tell you about the power of story later on in my organizing, maybe a decade later, after I had been working with many community initiatives and really noticing some of the really deep challenges our community had and some of the basic infrastructure we didn't have for solving or addressing those challenges. And one of the infrastructure we didn't have was any form of public transportation. And we had 2 failed initiatives to raise the tax dollars for having public transportation, which in Washington state is initially funded through sales tax. So here we had this challenge. How do we change the basic infrastructure which allows people to participate in community life? So transportation is a part of having resilient, healing-centered community, because how can you fully engage people in solving the problems of their own life and experiencing efficacy and control and choice and collaboration with others when they can't actually participate in community life because they can't actually get to any of the places they need to get to for participation. And so what we did was we looked up the laws and we said, okay, we have to have a transit plan. We had no idea what a transit plan was. I literally just sat on my couch in my living room and wrote out by hand something I called a transit plan. It was not a transit plan, but I followed all of the minimum requirements that it said I had to have, and so the state had to accept it as a transit plan. But then we had the challenge of how do we get a yes vote after 2 no votes, where people were digging in their heels. No, we're not going to pay for this. It's a poor community. We can't afford it. And so I reached to the power of story. And story is a very powerful tool for aligning people's interests. And so the story that we told, and we told it everywhere where we went, was a story about a couple who were actually friends of mine. And the woman in this couple, the wife and male-female couple, the wife had fallen and broken both of her wrists. When you break both your wrists, you can't do anything for yourself. You can't go to the bathroom, you can't zip up your pants, you really have to have help for everything throughout your day. And this was a couple who had been managing very independent lives. They were very competent, active, early retirees with lots of interests that both of them had. And they weren't used to having to spend all of their time together. And the husband in the couple wasn't used to having to set aside all of his concerns in order to take care of his wife. She was very independent, and he just didn't have that role in her life. So we told the story. You know, any of us at any time could fall on a slippery floor or outside and break both of our wrists like Helen did. And what would that mean in our lives? It would mean that other people had to set aside everything they care about in order to help us. It would mean we couldn't shop for groceries, we couldn't get to the doctor, we couldn't bathe ourselves, we couldn't dress ourselves. And what would really help everyone in that situation is if we could still get a ride, we could still get to the places we needed to get to. We still might need a friend that would help us with the basic inside of the household things, but we could still actually have a life if we could get from home out into the community, out to medical appointments, out to the grocery store, etc., where other people then could help us and we wouldn't have to rely only on one person. It turned out that story was a story that almost universally people could relate to. They could imagine a situation in which they would need a bus system. And we overwhelmingly won the tax base to start up the bus system. And interestingly enough, we started that bus system. We were the first bus system in our state that was funded after ADA requirements, so that we not only were able to start up a bus system, but we were able to follow through on our promise that no matter who you were, you could get a ride, because all of our routes included dial-a-ride options and included being able to pick people up from home if they had disabilities. So story, a powerful fuel, but you have to find the story that allows people to see themselves in it. And that can be a powerful way to build a coalition. Now, in this case, it was rare for us to have people come into a room. The coalition was by having aligned interest and through a campaign approach. When you're leading coalition development, you have this tricky balance that you have to strike. You have to have ambition, you have to know what it is you're after, you have to be convincing about it, But you also have to have a lot of humility because in fact, people will rely on you to structure the communication, to design the meetings, to structure data and other kinds of information and on and on and on. But they don't want a single person to be in charge. And so you are a servant leader when you are organizing a coalition. And you bring about change through stories, through organizing data in ways that it works for the people that you need engaged. But you also have to balance this notion of, I'm going to work like crazy behind the scenes. I'm going to do really a lot of stuff that isn't going to be done by consensus. You have to balance that with commitment to transparency, with letting people know what is happening, why you've organized information the way you have, and what will happen when we get together as a group. It's important because you're asking this group to also have a balance between doing really thoughtful, thorough work for getting a big goal accomplished, something like becoming a trauma-informed or healing-centered community. But you're balancing that thoughtful, thorough work with, you need innovation, you need spark, you need just-in-time action. And so this notion of balancing and noticing is really important in coalition development. One thing I try to do always is a lot of interviewing. And one thing that I'm listening for, I think you heard Tony Biglin ask some questions that were really wonderful, exploratory questions about what people really want in their community and in their lives. And those kinds of exploratory questions can be really valuable. So what you're mining for people's ideas and opinions, what are the actions that if we took them do we believe would make the change occur? And out of that, you're trying to look for, do we need a collaborative approach? Do we need a coalition? Or could we accomplish that in some other form that doesn't take as much time? Because coalitions do take a lot of time. If we decide that there's a series of actions that the community needs to take in order to accomplish its goals, then the coalition will serve a really practical strategic purpose of orchestrating that series of actions. And we can organize our meetings so that we're only meeting when we need group in order to do the work. I think there's nothing more frustrating as a very busy community leader than to be called to a series of meetings where I could have just read an email. I don't need to be in a meeting with 100 people in order to hear an update on someone's work. That's not necessary to have a group for. And so think about not only who the stakeholders are, but why do you need them? You need them to get the shared wisdom. You need them to generate a shared view, a shared language. You need them to actually be doing group work. And your job is to be continually improving that map of who the stakeholders are and how you might be able to use them in improving the conditions in the community. So you're constantly consulting with partners, you continue your interviewing process, you're finding out how to update that theory of change that emerged when you first did your conversations. In every case where I've seen really effective coalitions grow and be sustained over time, their focus will evolve, it will mature, and they'll go through essentially developmental stages, and great coalition facilitators stay up on what those are, and they can articulate them, and they can provide direction to the people that are joining that movement over time. And we're also noticing how to put feedback into the system. So we're talking to stakeholders, we're realizing if they learned these kinds of things, they could update their work. And so we're creating new data formats, new information, new stories. And so because we're doing that behind the scenes work that is informed by our interviews, it's informed by the stakeholders of the work, that's how we can pivot easily when we need to in order to keep the coalition alive. So here's a trick that I found. It's very simple. Probably all of you already do it, but I thought I would mention it in case you don't. just create a list of all the things you might need in order to make coalition activities successful. You might need somebody who's great with data. You might need somebody who will bring cookies to meetings. You might need someone who is able to frame issues. You might need someone who's able to teach some civics basics lessons, and on and on. Just brainstorm a long list. Make a half sheet of paper or a quarter sheet of paper that has that list, and at the bottom of the paper say, what would you like to be giving toward us creating a healing-centered community? Because so many times, people who are volunteering their time and effort, they're asked to give the most obvious skill they already do for their job. For example, a CPA is asked to be somebody who deals with money, when really that same person maybe would prefer to make some art and have it auctioned. Maybe they want to do something completely different that you haven't even ever thought of. And so when you keep a running list of what people actually want to be giving, then you end up with literally hundreds of pieces of paper that you can put into a database. And so you can call on people for the very thing they want to be giving. And there's nothing more powerful as a recruitment strategy for volunteer labor than asking people to do the very thing they want to be doing. And that's true also when Rob End and I train teachers that are teaching about neuroscience and self-healing communities. We often ask at the end of those for people to write, if you were using the science in a really great way, what would you want to be doing with it? We collect all that when we go back into that same community, or when our speaker trainers go back into that same group. They already know then what people want to be doing. So when you're building a coalition, recruit for what people want to be doing, what they want to accomplish, and generate stories about them actually giving that. One of the great coalition leaders in our state is Terry Barilla. You've probably learned from Terry if you've been in this work very long. She led the Walla Walla Community Resilience Initiative for many years. She's just recently retired. But Terry used to really talk about engaging everyone in the community in giving. And she was fearless in asking people to give. And I'm just going to take a couple minutes to tell a funny story about Terry, because it's illustrative of a really great coalition builder, which she certainly was and still is. So I flew in one time to visit Terry. At the time, I was a funder of that work in the community. And Terry put me in her van and she started driving me around these neighborhoods where they were really struggling to figure out how to create healing-centered, trauma-informed neighborhoods, although we didn't use those words at that time. And we drove past a house that it wasn't this house, but it looked a lot like this house. But it had a for sale sign out in the yard, and it had a sold sticker on the for sale sign. And Terry said, "Oh my goodness, that house sold. It must be somebody who's going to fix it up." Just a minute, Laura. She pulled her car over across the street from the house, and she looked at the address, and then she called the assessor's office and said, "Can you tell me who owns the house at this point? Who now owns this house at this address?" And the assessor told her, and she figured out what the phone number was of that person. That was still when we mostly had landlines, so she could look up the phone number. And she called this person. And while we were sitting there in the car, not 5 minutes after she noticed the sign, Terry starts to talk to this person. "Now, I noticed you bought this house at this address. You must be planning on fixing it up because it's clearly a derelict house." And the person says, "Yes, that's what I'm planning." And she says, "Well, this is a neighborhood where we're really trying to do some healing work. We're really trying to build the neighborhood's efficacy, their sense of control over their own lives. And we're trying to build a better relationship between the broader community and this neighborhood. And we don't have a place for people to meet. And we need a place for people to meet. That's really a critical thing. And if I promise you, that we'll do a good job of taking care of this property, could we meet in this house that you just built? We'll move from room to room. And so we'll meet in the old rooms while you're fixing another room, and then we'll move. And so that we won't be in your way, and I'll orchestrate all of that. But all we need is one room at a time where we can meet. And the person hesitated for a moment and she said, oh no, it's not something you hesitate. It's just something where you say yes. Yes, you say, yes, you can meet in the room because we won't be bothering you. There's not any reason not to. And it's something you can give. You're not going to be able to renovate every single room anyway. And so yes is the right answer. And by golly, she got a yes. And that's what you do with coalition building, right? You're asking people for these things that are surprising to them. I didn't know that would be something I could or should offer, but I guess I could do that because Terry already knew that a place to meet would be necessary. She didn't need a big meeting where they had a big plan about a place to meet. She knew people in that neighborhood would need a place to meet. So that's that balance between you're going to move behind the scenes sometimes faster than people can even imagine, but you're going to hold humility. You're doing it on behalf of other people. Time. Jesse, can you help me with where we are with time? Because now I have my phone on and my computer on. So
You're right. You're right. I mean, take the time you need to finish up here. I think that the people who were on are still very engaged. So.
Okay, well, I'm just going to try to take 5 more minutes and then
Cool.
tell you a little bit about what I could do should we want to talk some more. So when you're recruiting people into a coalition, just remember that recruitment is personal. And in that same way that we use the systems thinking iceberg, think about you're recruiting, you want to recruit for this lasting change. You want to recruit for that person to stay engaged with creating a healing centered community for the long term. And we do that by recruiting below the waterline. We're going to create based on people's sense of shared identity, their dreams. We live at a time where a lot of the population is in their 60s, like I am, and 70s and 80s. And people in their 70s and 80s are living into a period of time where what they really want to think about is what are they leaving on Earth? What ways are they going to create a better world for their children and their grandchildren? So when you're recruiting elders, you're recruiting based on that sense of legacy and based on this is the person I want to be remembered as. When you're recruiting somebody in that next younger age, you're oftentimes recruiting based on their sense of aspiration, or they're frustrated because they want to be engaged with innovation and they've ended up in their career in this kind of middle zone where we have to follow all the rules and we're frustrated by it because we can see that life could be better, right? And so we want to be given an opportunity to innovate, to be creative, to reach our aspirational goals. When we're recruiting, we also want to think about who has reach into different parts of the community because we want to create that ripple effect. We want to be able to strengthen the social networks and the social bridging in the community so that we get more impact from our coalition work. Very commonly, people are recruiting based on skills and abilities. And while that's an important thing to do, it's less important than recruiting based on the legacy I want to leave, or the creativity I want to contribute, or the social networks I am able to build. Those things create more lasting change. But the most common way to recruit into a coalition is based on people's positions. And it's probably, in my opinion, the least powerful way to create a coalition. Yes, you need the sheriff or the police chief. Yes, you probably need somebody from schools. Yes, you probably need all those different disciplines represented. But if you only end up with professionals based on their positional authority, they don't have the same intrinsic motivation to stick with it and to challenge their own mental models, to challenge the way things have already been done. B, in order to get to those positional kinds of authority positions, those people are really good at the status quo, including myself, right? I was a staff to a governor's cabinet for many years. I got very good at working with in-state bureaucracy. But when you're talking about change, you also want people who are very good at change. And so you want to balance out those people with positional authority with people who have other kinds of motivations that are below the waterline here in the systems thinking iceberg. You also want to build a coalition where you're inviting people to opt in. It's important that people realize they can come in and contribute something that's really big, and then they can back out and come back in when they can contribute something that's big next. And when you're proactively seeking people's voluntary participation, then they can contribute what is most important to them without feeling like they're going to have to give up all of their time, all of their energy to this coalition. Instead, coalitions can expand or shrink around the activities or situations you really need. But about once a year, once every 2 years at the least, you should have a large kind of meeting of everyone so that you can invite them to opt back in, right? Where you're carefully designing opportunities for people to engage, and you're carefully designing what the next steps might be so that people can see where that opportunity is and they can offer to help. Those offers to help will give your coalition a lot more power. So lastly, I want to really talk a little bit about procedural trust and having a core team that can build procedural trust. Because in communities that are deeply affected by trauma and adversity, trust is one of the hardest things to build. And all over the coalition building literature, it says you always build trust first. But if you've worked in a community that has very high ACE prevalence, very high historical trauma prevalence, you'll find a large percentage of people who do not trust, and they have very good reasons not to. And so you have to redouble your efforts to do things in a rhythmic and systematic way, to offer opportunity in a similar way every time and equally to all different kinds of players. You have to offer translation, letting people know where others are coming from so that there aren't big surprises, so that when we hear differences of opinion, we already knew they were going to come and we could already have thought about it some. You have to be willing and able, or have someone on your core team that can translate, but can also reframe. The civic skill of being able to listen to very different conflicting views and find a way to frame all of those in a way where we can see our common cause, our common shared identity. That is a rare civic skill, but you need it in order to build a coalition. So if that's not something you do easily, I would suggest that you recruit core team members that are good at listening to divergent views and building frameworks where everyone can see themselves in those frameworks. That will allow you to pursue a theory of change, to pursue those sequence of actions in a way where people understand why you're taking those actions. Even though they may disagree with this one action, they agree with the overall course of action. And so they stay in, they hang in there for the coalition. So when we're building coalitions, we essentially are strengthening the bridges between social networks. And we tend to have social networks siloed in communities. And so when you're putting in your initial time to decide who you're going to interview, who you'll recruit as the initial people, or who you'll recruit to expand your coalition, network theorists would suggest that we're going to pay attention to what is called weak links, or the weak ties. So don't ask for the people who you know or the people they know. Ask for people who they know that you wouldn't know, that you wouldn't have any access to. So in this chart, the people that have the dotted lines, you'll see each of those has a strong set of relationships where there are many lines coming out from them and connecting to a group. But they also have what is called a weak tie, where they only know one person in another social group. That weak tie is the one you want to follow. You want to be pursuing and asking, do you know anyone that I never would have ever heard of who is a natural leader in the circles where they work? That person you probably want to talk to, and you want to hear their perspective. because over time, you're trying to build the kind of coalition that will saturate all of the social networks in your community and ask them and engage them in coalition building work. So I hope I've given you some practical tools. I'm going to stop sharing here and just tell you that when I worked for the state of Washington, I did write kind of a how-to manual, and in it, I realized that there's some troubleshooting tips in it that you might be interested in. So let me know if you want to see some of that troubleshooting. If this is going wrong in your coalition, here's 3 things you might try to do. If this is going wrong, here's 3 things you might try to do. Because we all stall out with this work at certain points in time. We all need support to get out of a jam and back into the flow that coalitions can create. So with that, thank you, Jesse, and thank you, Denny, for inviting me and for your great work.
That was
Laura.
so beautiful. And it occurs to me that we should have had her also in our first workshop when we talked about building coalitions, because this deserves so much more time. I thought that was just an amazingly helpful, real workshop-y kind of talk, right? Really walk people through all the different kinds of steps you have to take and the nuances about creating an initiative of this sort. So thank you.
Thank you. Thank you, everybody that's still on the line, for staying, but also mostly for your amazing work. It's so inspiring. And I love to hear the stories of your work. So keep sharing.
Yeah. So Laura, if you're able to share that resource with us for our resource center, that would be great. I know we'll reach out to you about your slides. If there's a way that people can get a hold of you, folks are asking for that in the chat. To your comfort level, if it's ACE interface. Thank you, like Laura said, for the work that you all do and for staying on. This has been an incredible session. We went through so many sectors and so much information. This whole workshop series is drinking through a fire hose. I feel like this one was getting sprayed with multiple fire hoses at once, but it's all so good. It's such fantastic information. And again, so the resource center, having the recordings, having all of this information in one place compiled is going to be so valuable, not just now, but also moving forward to refer back to send people to. And now is the part of the day where we go to our own breakout rooms and we get to engage in conversation with one another about what we learned, what we're thinking. I put the Zoom link in the chat. Whitney, our good friend, is already waiting in the room if folks want to jump off now. And you can also find this information at the National Prevention Science Coalition to Improve Lives, npscoalition.org, their website, on the Building a National Movement to Prevent Trauma and Foster Resilience Workshop Series page. You can find the breakout room at the bottom in case you didn't pick up on the Zoom link that I pasted in the chat earlier. Denny, do you want to take us away?
Already way up there in the chat, so.
Yeah, I know.
Plug it in again, right?
I will plug both in.
Engaged audience, and I just thank you all so much for your commitment to this cause. It's so important, and even after we're done with our last session at the end of April, there is obviously so much more work to do. This is not meant to be a one-off, so
This is just the beginning.
It's just the beginning, absolutely. So we look forward to working with all of you, and we'll see you in 2 weeks.
Thanks, everyone.
Take good care, everybody.